Great.
Okay, now that I was getting everybody's information, I don't have the agenda up on the screen, but do you want to go ahead and read the
Sure.
rules?
I can do that. This is the City of Boulder Cannabis Licensing and Advisory Board meeting for Monday, May 1st, 2023. The time is 3:13 p.m. We will begin with the instructions for virtual meeting and rules of decorum. Is everyone able to see my screen, or is it giving me fits again?
Nope, it's working.
Perfect. Public participation at Beverage Licensing Authority and Cannabis Licensing and Advisory meetings. The city is engaged with community members to co-create a vision for productive, meaningful, and inclusive civic conversations. This vision supports physical and emotional safety for community members, staff, and board and commission members, as well as democracy for people of all ages, identities, lived experiences, and political perspectives. More about this vision and the project's community engagement process can be found at the link shown on your screen. The following are examples of rules of decorum found in the Boulder Revised Code and other guidelines that support this vision. These will be upheld during this meeting. All remarks and testimony shall be limited to matters related to city business. No participant shall make threats or use other forms of intimidation against any person. Obscenity, racial epithets, and other speech and behavior that disrupts or otherwise impedes the ability to conduct the meetings are prohibited. Participants are required to sign up to speak using the name that they are commonly known by, and individuals must display their whole name before being allowed to speak online. Currently, only audio testimony is permitted online.
Thank you. Want to go ahead and do roll call?
Certainly. Member Anderson.
I'm actually admitting member Anderson right now.
Oh, there he is.
Certainly. We are calling roll at this time. Member Anderson.
Present.
And Kristen or whoever is controlling things, we need to turn cameras off for some people.
Not sure if you heard that, guys. I'm here.
Yeah.
We
Thank you.
did. Member Christie. Member Daniel.
Present.
Member Green.
She said about 5 minutes.
Thank you. Vice Chair Keegan.
Present.
Chair Kunzman.
Present.
Member Noble.
Present.
Ex officio member Thompson.
Present.
Ex officio member Bailey.
Present.
We have a quorum. Moving on to the approval of the Cannabis Licensing and Advisory Board meeting minutes from April 3rd, 2023.
I didn't realize I was muted. Was there anybody who had any comments, corrections, or suggestions? And if none, I will take a motion to approve.
Move to approve.
And a second on that.
Brian seconds.
Anyone opposed or abstaining? Okay. And then Robin has some speakers coming, and it worked out that they are able to come now. Oops, Michael's calling me.
Certainly. I can manage this portion for you, Chair Kunzman.
No, that's okay. I just told him I can't call or can't answer. The way Robin had things set up is that they're going to arrive, or they're arriving virtually now. And so I put a message to staff and Brian about changing the agenda a little bit, delaying the elections of chair and vice chair and general public comments of the board and the policy suggestion forms until after the discussion of cannabis hyperemesis syndrome. Ethan already weighed in and was okay with that. Is that correct, Ethan? Brian, I didn't get your input yet.
That's okay with me.
Okay, and where is he? Evan, how do you feel about that?
I'm totally fine with that. That's fine.
Stacy?
I'm just getting on, Tom, so you'd have to repeat the question.
Oh, we're gonna put off a couple things because the cannabinoid hyperemesis syndrome speakers are here or arriving virtually.
Like later in the agenda, you mean?
I'm just gonna move the agenda around a little bit.
That's fine by me, and my apologies for my late arrival.
Oh, that's okay. Okay, so Robin, do you have a quorum of speakers?
Yes, I think everyone's on. I think
Okay.
everybody's on, Chair. Thank you so much.
Robin would like to introduce the session, so. The
Okay,
discussion.
great. Thank you so much. And I'm so glad everybody's here. I've been dying to talk about this subject really ever since I joined CLAB 3+ years ago. So we're going to talk about cannabis hyperemesis syndrome, and this is a condition that my kid experienced. And the interesting thing about cannabis hyperemesis is that the misunderstandings of this condition can really cause people to suffer for much longer than they have to. And it can cause families to spend gobs of money on emergency room visits. For our family, it was close to $100,000 because my kid, he was a young adult, but he was in the ER 11 times over 9 months. And he was just so convinced that there was no way cannabis could be causing this because it's medicine and it makes me feel better. And this is what we treat people for who are getting chemotherapy when they're feeling nauseous. So I think I'd love for CLAB to hear from our speakers. I'm going to introduce them right now. They are just a really bang up group of experts. And the first person who's going to talk with us is Alice Moon. And she is a cannabis industry comms person, really. And she also does consults with cannabis companies. But she experienced CHS herself. She's going to tell you her story and kind of her perspective. And then we're going to hear from Dr. Karen Randall. She's on. And Dr. Randall is an ER physician, and she's going to tell us how she's seeing things in the emergency department. We have Dr. Richard Holdman. He is the manager and medical consultant for the Colorado Department of Health and Environment. He's going to talk about this need for a billing code for CHS specifically, so we know more about how much this is happening, because I can tell you a bazillion anecdotes, but a lot of anecdotes does not equal data. And then finally, we have Nathan Dewey from the Responsible Association of Retailers, and he does a lot of educating around alcohol, wants to do more on cannabis, wants to be more connected with our board. So I'm going to stop talking and I'll hand it off to you, Alice. Thank you so much for being here.
Thank you so much for having me. Thank you everyone for your time today. So a little bit about my background. I've worked in cannabis for 12 years. And in 2016, I started getting really sick. Every so often, like once a month or so, I would just throw up profusely, and then I would feel better the next day. And this happened frequently, and it started becoming more than just once a month. It became once a week, and then it started becoming every day. And I was sick for 2 years before doctors diagnosed me with cannabinoid hyperemesis syndrome. I saw numerous doctors. I was poked, prodded, had every test done that you could imagine, spent, like Robin said, a lot of money on my medical bills, and doctors couldn't figure out what was wrong with me until I finally saw a specialist who diagnosed me with CHS. And at first I was skeptical. As somebody who works in cannabis, I didn't necessarily believe that it could be cannabis making me sick. So I wanted to have one last infused dinner. And so I went to that. And then that caused me to throw up for 12 days straight, nonstop, all day, every day for 12 days. And so it made me realize that it was indeed the cannabis making me sick. So I took a 3-month break. I tried to reintroduce cannabis into my life again, and unfortunately I got sick. Then I took another break and I tried to introduce CBD into my life, and unfortunately that led to a 16-day episode. And I'm talking all day, every day for 16 days. It was a near-death experience. I was down to 105 pounds and I'm 5'6". It was very, very scary. Despite all that, I'm still 100% pro cannabis. I just believe that we should be researching it. We need, like Robin said, a medical code. We need to be keeping track of this in our medical care system so we know how many people it's affecting, and we can work towards finding some solutions for people who are suffering from this.
Thank you, Alice. That's great. If you can hold for questions, we'll have the other speakers talk about their background, and then we'll come back to the board for questions. Okay, Dr. Randall.
And
Hi, I hope everyone can hear me. I practice in Southern Colorado, so I practice in Pueblo, and I work at the third busiest emergency department in the state, Parkview. And when all this started, I really didn't know a lot about cannabis, but I knew we were seeing the harms pretty frequently. I did get my certificate in cannabis science and medicine to have a better understanding. I have spoken as far away as the Parliament in Australia and Portugal, and pretty much to multiple senates here. So a couple things about CHS. What we do know is it's impossible to predict who's going to get it. I can't take a room of people and say these people are going to get CHS and these aren't. The patients, as you said, Robin, are very reluctant to admit that it's a drug that they love that's causing their illness. So much like smokers with cigarettes, although that's more normalized and people admit it now frequently, and probably greater than 90% of the time when I see someone with CHS, they again don't want to believe it's the medicine or the drug that they love. We know that cannabis, and frequently they'll say cannabis is using chemo, so it helps with nausea, and that's why I took more and I get sick. And actually the chemo doses that are recommended are remarkably lower than what is recommended or what people are taking recreational. But there are several case reports currently now in the palliative care literature that many hospice patients are now experiencing CHS and have to come off their treatment plan. It can be seen with both CBD and THC, and now there's a report that you can actually see CHS with Navalone as well. The costs for CHS alone are exceptional. As you said, your costs were greater than $100,000, and I'm just going to ballpark these figures for you. An ER visit with medications and a doctor's fee and a facility fee and IVs, not including CTs, not including admission, is roughly about $5,000 billed. It's not what we get, but it's billed. We see a CHS patient probably at least minimally one a day, and probably more, but if we go conservative, we say, I'm gonna see one a day, and the cost is then $1.8 million just for our facility. There are 25 facilities in Colorado, some probably less than others have CHS, but if you add that up, it's a cost of greater than $40 million to the public at large. And then I can sum up CHS, what I see. The youngest I've seen is 13. The oldest I've seen so far is 63. But I just like to sum up this case because this is what we see. And not only do we lose money medically, we lose the person. We lose their livelihood because they're sick so often. If it's a younger person, they lose their education because they're not able to go. And I'll sum it up with this case. I'm going to call this patient Zoe, and Zoe started cannabis when she was about 12 or 13. By the time she was 14, she was using daily, and she was vaping, so she was using concentrates. And she started coming into the ER, and it would come in clusters. So, and people seem to get sick in clusters. And the first year, I'm going to guess that she had probably 30 visits to the ER, multiple admissions, but probably 30 visits. The next year, which is last year when she was 15, She had over 70 visits to the ER. And at this point, she's not in school. There's no way she can be in school and be in the emergency department 70 times in a year. And that doesn't include admissions, and it doesn't include being ill at home. And she's 15. So she's not in school. She's losing her education, and the costs are phenomenal. If you're taking one person with 70 plus visits to an ER every day, but it's sadly not the exception. And when I practiced medicine in Detroit 10 years ago, CHS was so rare that it was like a case report. And now I just came from a conference in emergency medicine, and I asked my colleagues, if you see a person who's vomiting between the age of 15 and 60, what's the first thing that comes up on your differential diagnosis? And pretty much everyone will say CHS. It's exceptionally common.
Dr. Randall, so much. Yeah, I would just underscore that it's become so common that I know somebody who was misdiagnosed as CHS and had a different problem. So it's like the pendulum has swung in the other direction, which is kind of concerning as well, which brings us to Dr. Richard Holdman from CDPHE, the Colorado Department of Public Health and Environment, who can talk about this hospital code. Please go ahead, Dr. Holdman.
Yeah, thanks for the introduction, Robin. As she said, I'm a projects manager and medical consultant for the State Department of Health, and I currently oversee the Retail Marijuana Public Health Advisory Committee. So underneath that, we have an ongoing systematic literature review, and we also monitor the health data from various sources like the hospitals. And so over the years, we have developed an evidence statement for CHS that has strong evidence behind it for at least a couple years now. And it is proving that there is evidence out there that long time daily or near daily use is associated with CHS. And we also have from the evidence that marijuana users who stop using marijuana have found relief from this illness. So we have both those public health statements out there. We're constantly trying to meet on committees like this or do presentations. Last year, I was at Public Health in the Rockies talking about this, just trying to increase physicians and anybody's knowledge about CHS, as we do see it in our data that people are going to the EDs and staying at hospitals at increasing rates almost every year. We monitor the inpatient and outpatient through the emergency department. And how we do this is through billing codes. So for those that aren't aware, anytime you go to the hospital, anything that's done at all, you're going to receive a billing code, whether it was just talked about, if you went through a procedure, things like that. So there are currently some marijuana codes. However, these are limited as they are just simply stating that there has been a use, abuse, or dependence in this patient. So they could have simply stated that they used marijuana, or they could literally be there for that visit for their marijuana use, for example, CHS related. However, we have done a few preliminary studies. The state did ask us to basically do a report saying how we can identify marijuana related cases in the state of Colorado. And unfortunately, at this time, it's pretty limited, as we're not sure why these patients are getting these codes, as they are not very specific at this time for anything related to what the symptoms are that they experienced, other than simply that marijuana use has been documented. So there have been a few studies that we also use in collaboration with our data to show. One of them, for example, is by Dr. Sam Wang out of the University of Colorado, and he attempted to show how they could combine these marijuana codes with vomiting codes and see if that could identify these cases. However, his results came back basically stating that it greatly underestimates the caseload of CHS. So these codes, while they will identify some patients, it's extremely limited at this time to identify those CHS patients. And that is why, as we've heard already, so many people go through these extensive workups, as they're not identified right away from that differential diagnosis of gastrointestinal problems. So where this has led the state of Colorado is we are currently working with members from the CDC and also the Council of State Territorial Epidemiologists to try and come up and influence the ICD people to add a code specifically for CHS. So those requirements will be developed, but basically we're following the literature and just showing that it is that long time daily cannabis use, that heavy cannabis users can develop this syndrome of vomiting. And so through that raised awareness, we're hoping to raise awareness for this code that will one day be implemented. And that way we can actually track this syndrome through their surveillance data and know how much it really is impacting residents of the state of Colorado.
There'll be some follow-up questions on that, Dr. Holdman. That's really important, not only to try to understand the big picture, but I mean, you know, for my kids' 11 visits, nobody ever wrote down anything about this that added to his confusion. He was definitely coded for cannabis misuse disorder, but it wasn't related to this vomiting thing. So again, you know, Facebook is what helped us there. Nathan Dewey is joining us. He is the director for the Responsible Association of Retailers. And I'm so glad Nathan's here because he's interested in helping licensees educate consumers about what they need to know. And the thing about, I'm going to let you talk here, Nathan. Let me just tee it up a little bit. The thing about CHS is that resolving it is easy. You stop using marijuana. And if you have a use disorder, it might be hard to stop using marijuana, but that's another issue. The big issue is to stop using marijuana. So if you find yourself vomiting very, very frequently as a user, and you get relief from a hot bath or a shower, you should stop using cannabis. That's a message that I think our retailers could help us with, or we could ask our bud tenders to understand that a little better. So Nathan, I thought if you could tell us about your group and how you might liaise with some of the folks that are out there, and I'll let you talk now. Sorry about that.
Sure. No, please. I won't go too far into the weeds on exactly what I do. I know I'm going to get the opportunity to talk to C-Lab at the beginning of next month, but real quickly, RAR is a nonprofit program, and our main focus is to help retailers in the community not only responsibly serve and sell alcohol and obviously just sell cannabis, but also to go a step forward. We are actually a youth prevention and wellness program. We were originally with a nonprofit called Team Fort Collins, which is kind of famous in Colorado for helping to shut down the cannabis industry up in Fort Collins. And at the same time, when I was hired on, we rebirthed it and helped the retailers up in Fort Collins join their own kind of cannabis retailer association. So just really what we do is we hold our retailers on the cannabis and alcohol side to a code of ethics of morally and ethically serving and selling alcohol and cannabis to the community members, with the idea that really what they're buying into by joining us is prevention for youth and the wellness of youth, and to making sure that, you know, it's only used for adults. And we don't even use recreational use. We try to pin adult use. And that is something we will be looking at for moving forward in the Boulder community. We have been doing cannabis work with retailers since 2015. RER has been working with alcohol retailers since 2004. Unfortunately, a gal overconsumed alcohol in the community at the time, and RER joined with CSU and the local law enforcement to create their alcohol chapters. And again, as I said, in 2015, I was hired on to kind of reinvent it for the cannabis industry. Since that time, just a little background so you can understand where I'm coming from as well. I sit on Governor Polis's MEOC committee. If you're not familiar with that, it's the Marijuana Education Oversight Committee for the state of Colorado. I sit on that board with Dr. Holdman's associate Ali Maffey. We also sit on there with CDOT, with anti-marijuana groups, pro-marijuana groups, industry groups. So it's a real big mix. And this is something I was going to approach them with last week, but unfortunately the meeting got postponed. But this is an issue I will be now confronting them with, because it's not something we talk about a lot. But after talking with Robin and really doing some more research on my own, and connecting with the CDPHE as well. I think it is an issue we need to talk about within our community. So what does that really mean? Just so you know, I am a certified bud tender trainer for the state of Colorado through the MED. I routinely and monthly provide cannabis trainings for these folks. And this is something that I can educate them on in these trainings. During the trainings, I already educate on things like breastfeeding. As we all know, that's a danger for the little ones who are breastfeeding. You cannot smoke marijuana and breastfeed. So that's something we've put out into the community actually through the retailers. So I was really happy when Robin approached me because I wanted to be connected with you. As Kristen knows, I'm heavily involved with BLA, the Boulder Licensing Authority. I've been working with them since 2019, and I've just had a hard time getting into the cannabis industry, but it's something now that is we're granted through a substance education award through the city of Boulder and the county of Boulder. So we have money. We have money to get these retailers on board, and we'll get more into that later. My main mission with this now is, even as a person who had cancer and has seen a lot of people use, really isn't something that's in the public knowledge. I don't think CHS is something people are aware of if they are vomiting, like Alice Moon mentioned earlier, her experience. And just hearing her experience from someone who was within the industry and then developed this CHS, there are probably so many people out there that we can help. Just like Robin said, her kiddo, they didn't really know what was going on. We don't need to have them go 11 times to the emergency room. Let's get that information out there. And RER is a vehicle to get that out there. And what do I mean by that is I will literally be, and then I am actually now working on some literature that we can release up in Fort Collins dispensaries, so that with every single sale, we're putting out this information, just like we've done with breastfeeding. They will, and I'm telling you, at least my members now, will voluntarily hand out this information, even though it may be detrimental to their sales, detrimental to their business. Really, when they join RIR, the greatest cause, the bigger cause is the community and education. And they really don't want people suffering like that. They wouldn't want from the majority of the folks I know, they don't want to make a sale over someone's personal suffering. So I think this is going to be a really good vehicle for me to meet all of you, to be able to communicate with all of you and sort of voice my opinion on what can we do, because it's not just through that sales that we can do it, but we do, like in the city of Boulder, we do have some of that funding for grants to actually put this message out, maybe onto bus stops and things like this, or whatever we need to do, or at special events in the community, concerts, these sorts of things. We can kind of get it out to that community. Maybe if there's a 420 party, we put that out there where it is in the 420 party, and we advertise. So really, we're a vehicle for the community. We're a resource for the retailers, but for the community at large as well. And like I said, this is something that's a little bit newer to me. When Robin approached me, I knew about it, but I didn't realize after the research I did, it was such a serious problem. And so many people are being affected by this. And that just shows you, when you've been a guy who's on the MEOC committee, I've got my ear to the ground on a lot of things concerning marijuana and side effects. And, you know, we did a big thing on psychosis and things like this with marijuana and how that can be triggered. So I think this is just our next evolution in helping the community and the retailers also educate their folks, and really just getting the message out to the community that, hey, this exists, it's proven, it's medical, and let's show you what you can do to get away from it, right? Either help find them the resources to get the help they need, or actually just say, hey, you need to stop, that kind of thing. And so again, we're not a pro marijuana, we're not anti, we're here to embrace the legalization of it and make sure that it's the safest possible thing for the people who are purchasing it and the people who are surrounded by it. So yeah, I guess that's it in a nutshell.
Wow, that's great. Thank you so much, Nathan. That's super helpful, and I hope we can collaborate in some way, shape, or form to just get this simple messaging out there so folks aren't confused. Okay, I wanted to open it up to the board members, and maybe we just go around the circle, but if any of you have a question for one of the panelists, please go for it.
Anyone?
Okay, so I just have a question just from a medical and public health perspective, just like what are risk factors or anything? Is anyone aware like the risk factors that are predictors or correlated with beyond cannabis consumption with the cannabis hyperemesis syndrome?
I don't think we actually really know that there are defined risk factors. The biggest correlation that we have is the more you use, the higher concentrate, the more likely you are to have an event or develop CHS. I don't know of any particular identifying risk factors.
Yeah, I think I would echo that and say, the data unfortunately is a little limited, but we can look at our data to see the groups that are using daily the most, et cetera, like that, and kind of make some assumptions, but I don't know how well that will translate into the medical findings.
Great, thank you. And thank you all for your presentation.
Stacy?
I have a question. This might be also directed more towards Dr. Holman, but definitely it's very clear we need to get the public health education on the ground like everyone's talking about. And I think that's beyond important. I'm just curious, to what extent are we chasing provider education? Because from what you're describing, it really sounds like that's the biggest key. Like with other disorders, especially ones involving substances of abuse, it's hard for patients to self-identify. So that, and for a variety of reasons, but then it becomes, in my mind, this major concern of provider education. Like, how can we get in GI clinics, ERs, et cetera, with that type of information is what's on my mind, because I feel like that's probably going to give us even more bang for our buck. Sure, we absolutely need the public health and people to have this awareness, but I still feel if we don't chase the provider education even more, that we're still not going to get the data you were referring to, hoping to get and collect and then be able to analyze, et cetera. So I guess that's on my mind. Like, how do we do that?
Yeah, and you're absolutely right with that. Even if we had a code, how do we get them to know it exists and to use it and identify? And that's definitely one of our big pushes. And unfortunately, at the state of Colorado, our prevention services sister program lost a lot of their funding. So they're currently in the rebuilding phase. They're rehiring and all that. So once they're back together, it is one of our main goals, along with a few other of our, what the data shows of who's being impacted the most by these health effects. So it's definitely going to be one of our driving points. And that's why we always try to take it to and present at random conferences and get publications if we can. Those are a little slow moving, unfortunately, but it's definitely, how do we reach the physicians best? And there's a few ideas out there for sure. But.
And I would second that for sure. And for the last probably 5 to 7 years, I've been speaking at multiple conferences because I literally am truly amazed that there are physicians here in Colorado who don't know that, who are primary care and don't have any idea. And even emergency physicians, even though we think CHS, they don't really have a good idea what it is, how it's happening, and how the patient needs to treat it. So I've been speaking at conferences for quite some time. We've been publishing, and there's isaacs1.org is a physician group that publishes about medical problems associated with cannabis. And I know many of the doctors there are also speaking. The information now seems to be getting out more readily, and there seems to be more acceptance in this, but it had been limited in the past.
Do you think this is replacing a lot of what was being diagnosed or could as cyclic vomiting?
Oh, 100%. In the early days, like prior to the concentrates being so the potency increasing so much, there was probably cyclic vomiting that just existed, and it's also probably a close tie into like diabetic gastroparesis. But it may have been that diagnosis. But the issue that I find is very difficult. So I know that from the public health perspective, that it's very difficult to say this is CHS, right? Because what I've found clinically is most of the people, like I said, don't want to admit that it's the drug they enjoy causing their illness. So what I say to them is this is basically like your body's allergic reaction to it. and you need to stop. But when you put that diagnosis code in, that code isn't always benign. It will follow the patient. It's in their medical records and it's listed there. And the only complaint I ever got to the medical board in 25 years was I put cannabis use disorder on a lady who admitted she was using 5,000 milligrams of cannabis a day because she just didn't think it was a problem. And so a lot of physicians will just code these patients as nausea and vomiting as opposed to saying CHS. And when you're looking at this diagnosis from a perspective as a physician, these patients present, and I know you saw your son, and I know many of you've had these symptoms, they're pretty profound and they're pretty acute. And so when you first see that, you're like, wow, I got to get some blood work. I got to give them some IV fluids. Many of these people get repeat CTs. And a lot of times when you see these patients, the information about I'm using cannabis isn't forthcoming. And a lot of times then the docs don't even ask, although we should. We ask about other substances. So I think that's part of the problem.
Well, that's what's on my mind, just, kind of going back to the basics there, where, we probably do need to get that level of provider education, because we need to be asking as providers if everybody is using a substance that has potential health effects, right? We ask them if they drink usually. So same idea, just it feels like that could likely be a bigger bang for our buck, based on what sounds like the objectives for CDPHE.
I think that would be a good place to start, which is when I speak at like the academic emergency medicine conferences or other places, I usually include that in my lectures so that the providers know and understand. But also there has to be, I think, what Nathan is saying with education and maybe a pamphlet in the shops so that the patients or the people who are consuming actually look at it and say, you know what, maybe that is me. And the Facebook, the Cannabis Hyperemesis Facebook group has been like tremendous, because I now actually have some patients coming in saying, I think I might have this. So that's been, so I think getting the knowledge out to the public that this is a problem, and having the bud tenders put a brochure or speak about it would be awesome.
So I worked with
Thank you all.
I worked with the Institute of Safe Medicine Practices Canada to come up with a brochure that they distribute through emergency rooms throughout Canada. And it's a very patient-friendly brochure where it's not fear-mongering about cannabis at all, where it's just straight to the facts. And they've been distributing that for a few years now, and it's available to be licensed throughout other hospitals. I think it's just like a couple $100s to get the brochure, and then it can be distributed wherever we would like.
Is that information on a website, Alice?
Yeah, I can email it to you. Absolutely.
Yeah, that'd be great. Thanks.
Mhm.
Yeah, one of our big pushes is to get doctors to screen cannabis, very much like tobacco or alcohol, but that is a massive ask and big process. But we got to start somewhere. So I think this will help get that at least discussion going for sure.
Well, thank you all for your time. I appreciate you answering my questions.
And I would echo that, each and every one of you. And I appreciate, Alice, you telling your story. It reminds me so I was the medical director at the Student Health Center on campus here, and somewhere around 10 to 12 years ago, I remember I had heard about cannabis hyperemesis syndrome, and there was a student that came in, I think it was a male, and I wondered, I suspected, I sent him off to a gastroenterologist who had never heard of it and thought I was, crazy for suggesting it. And the patient, they didn't want to hear that. They didn't want to hear that, it's time to give up or time to cut back on cannabis or, stop cannabis for a short period of time. And, but in the end, that's what it turned out to be. It was probably one of the earlier, at least known Colorado cases way back when. But I remember kind of fighting a battle to get it from a primary care provider's point of view to get it diagnosed. And so I have questions. I don't know if you want to comment about that, Alice, or
a lot of people in the cannabis industry don't believe that CHS is real. I've been bullied nonstop for the last 5 years by people who work in cannabis or who are fans of cannabis who don't want to believe that this is real. A lot of doctors don't know about it. I've gone to urgent care and, educated my own doctors when I'm getting an IV because I'm so sick. And it's really unfortunate that there is this, anti-CHS commentary when I have the lived experience. I know that it is real and it's unfortunate. And, even secondhand smoke makes me sick. So I can't go to cannabis events. I can't go to concerts. I can't go where there's ever public consumption allowed because it will make me extremely nauseous and potentially throw up. So I am all about, educating people about this syndrome because I don't want anyone to suffer as much as I did. I was extremely sick for 2 years and it was really, really scary. And I want to do as much as I can to help people. And I've done a lot of public speaking. If you Google Alice Moon Washington Post, you can find a really detailed article about my experience. They did a cover story about 2 years ago. And I've done a lot of other PR opportunities and spoken at a few medical conferences because I'm that passionate about helping educate people about this syndrome.
Thank you for your passion, and keep up the good work. Questions for Dr. Holdman and Dr. Randall, I believe, right? You don't have your last name up there. So on the coding thing, especially for the ER doctor, I mean, there's been a discussion, I'm just going to take it away from cannabis for a second, that if you're trying to keep track of bicycle injuries, some ER doctors are supposed to add an add-on that this injury, like this broken bone, occurred because of a bicycle. Now, so it's kind of like an add-on code. Where are we at in terms of just adding a marijuana code? And I know that, as best I understand, the US is not using ICD-10 or 11 yet. 37 countries around the world are, but we're not. And how likely is it that we can get a code added to ICD-11 that would just indicate that cannabis was used, and then it would, when Dr. Wang, I guess you said, would be looking at his data and they saw this nausea and vomiting in the cannabis code, that would take care of the problem, right?
That's how I do it right now, is I try to put nausea and vomiting and then cannabis use, so that hopefully when they do a search, it comes up as cannabis use, nausea and vomiting, which is a key to CHS. But again, like I said, and I think it has to do with the fact that cannabis was considered illegal or illicit for so long. And even though now it's legal and it's recreational, people still think, I'm not going to tell the doctor that. And I can't tell you how many people withhold that information. There's also a cannabis presentation that's like a stroke mimic, and it's mostly in older people. And 100% of the people that I've seen with a stroke mimic from cannabis withhold that information until the very end. And they've had CTs and MRIs, and they say, well, grandpa ate like 42 pounds of cannabis butter. Do you think that was it? And so I think there's still a stigma in a lot of people's minds. So no one, I mean, if I put alcohol use or tobacco use, so like the government asked us to code tobacco abuse for a long time, and those people who had tobacco abuse, no matter what, they came into the ER for. And so people got used to that and people accept that, but I don't see that acceptance yet with cannabis. So if somebody comes into the ED and I put cannabis use and they happen to work for CDOT or the Department of Corrections, it affects them. And it's like more so than if I just put alcohol for some reason. And so again, the public is reluctant to admit that to me. And I don't know how we change that. But with CHS, I think it would be really important just to get one diagnosis so that we could put it in there so that these people may not have to undergo endoscopy or repeated CTs, because we can say it's CHS. And the treatment for CHS in the emergency department is really different than just someone who has vomiting and nausea.
Yeah, going a period of time, 1 to 3 months without marijuana is a lot cheaper than getting endoscopy for most people. And Nathan, we need to have responsible association of ER providers, I guess. We need to educate the ER providers as to, or all providers really, as to how to code or how to evaluate things better, I guess.
Yeah, I think that's even something, if like Alice just mentioned that brochure, I would love to see that. Because normally I develop it on my own. I have a promotions and marketing background, so I can do that, but I would much rather use something that's, scientific and codified, and it's been legitimized. And that's something I would not mind reaching out to local emergency rooms and distributing. And the other thing we can do is distribute it out through schools, through youth programs and things like this. Maybe not for the elementary, but for the high schoolers. I think that might be something that would be valuable for us to do, as we do something called Brainwise for these kids, where it's a lizard brain thing. I don't want to speak much on it. I don't know enough, but that's just actually, you just gave me a great idea. We could actually disseminate this information out into the public that way there. So there's a lot of outlets I think we could do this with.
Well, we'll get a copy and we will send it out in our next packet also. Note that, Kristen. And then just real quickly, I'm sorry for taking so much time, but Brian asked a really good question about causative factors, and I keep forgetting Dr. Randall's last name. She mentioned the length of time maybe that somebody had been using cannabis, or the concentration. There's some data that appears to be coming forward that suggests genotypes may be a factor too. Different types of cytochrome P450 enzyme, that we all have different genotypes, and that may be a factor that leads some people to getting CHS versus others. I don't know if it's all going to be that simple, but anyways, did you give any thought to that, either Dr. Holman or Dr. Randall?
I wish that cytochrome P4 factor identifications would be available, but those, I can't see that being readily available to me as the guy in the ER seeing these patients. So I think if there's a way to come up with identifiers that are, a little bit more clinically oriented, because no one's going to come in with a cytochrome P450 assay.
Yeah, that's
Yeah,
true.
Definitely agree with that. I have read the article that you're probably referencing that identified, certain people are more prone to this. And I think that at least leads into the education of knowing why these people get affected by it differently than other people when they use the same amounts. Some people are going to get CHS, others aren't. And I think that's the answer for that. But unfortunately, that's not a way to identify in the ED.
I know. Yeah, it's something in the future. Millions of people have gotten their genotypes done through 23andMe and Ancestry.com. And if we could talk those two companies into adding a genetic test, then that would be great. Brian, go ahead.
I think Kate was in front of me, but.
Oh, was she? Okay, sorry, Kate.
I hopped back. Brian, you go ahead.
Okay. My question was just, again, from like a public health perspective, and just zooming out from CHS specifically, are there models that any of you are that have seen, or that you're trying to emulate, right? So like smoking cessation, back in the 90s and early 2000s, was that something that's worth trying to explore or pursue here? Like what's like appropriate kinds of like policy levers or interventions for around education, around policy change that you're looking to, or you're trying to emulate and say like, this worked before, we should be doing more of that thing around CHS? Like what are those other things that have been done in the past around education, around testing, other kinds of things that could be adopted for CHS?
Yeah, I think one of the first places to go is we can copy, what we have learned from alcohol and tobacco prevention efforts, targeting the most at-risk users. So we already know that people that get CHS are using a lot more than the average user, typically have a pattern of daily use or very close to it. So I think targeting that population with the facts would be a helpful prevention campaign to do, since we know it works for tobacco and alcohol. And like Alice said earlier, to just come out with the facts, not the fear mongering about cannabis use, and just simply stating that some people are at risk for it may help reach those customers.
Right. And Anyone else want to respond to that? Or? Okay.
No, I really think
Oh,
education
go ahead.
to the general user and public about that. If somebody said it, that the people who come in don't want to believe that CHS is, real, or don't want to believe it's caused by marijuana. But if we can get the education out on brochures, which I think is a great idea as a warning. And the other thing is we ended up teaching the public that smoking was harmful. And now, like, if you ask anybody, they'll say smoking is bad or harmful. And I think we get that message out associated with CHS. And really the only way to really effectively treat it that we know is to stop with that message along with the information.
Anyone else want to respond? And if not, Kate?
Yeah, obviously, I also want to say thank you to everybody for the presentations, and Robin, thank you for bringing this to the table. Obviously, I know that you've been wanting to talk about it for a long time, and I think the biggest part about this, right, about anything, is education and awareness, and that's what you're doing, and that's what you've done through this conversation today. So, just a huge, thank you for that. I think, I do want to talk about educational materials because we've talked about it before. And I just want to make the comment that, from a bud tender perspective, I hesitate to want to have them talk about it at all. Bud tenders are not medical providers. They're not doctors. We talk about this all the time. No, don't use absolutes. It's not treating something. It's, I think talking about, for me, it's always been, cannabis is medicine, right? And medicine has different side effects and can affect everybody differently. And so we talk about kind of that kind of realm of education, right? But in terms of CHS, it makes sense that there would be something from CDPHE, something from the Med for responsible vendor training. Like there's a lot of things that need to happen. And I think a pamphlet is a perfect way to do that. That's at dispensaries and available to the public. I just really want to say that I'm very hesitant to like have bud tenders be the ones having the discussion without true understanding. To make sure that we're giving the information accurately and without bias. So I think that just wanted to kind of put that out there. I also think that people are probably reluctant, at least partially, right? I can't say, for all of the people that come in because everybody's different, but a lot of people are reluctant, but because of what you said, Dr. Randall, about, the fact that maybe they work for CDOT, maybe they work for an organization that does drug screenings that don't allow them to consume a legal state product, right? And so they're reluctant to have anybody put that on there, so they don't give that information. So that, from a policy standpoint, from a federal and state perspective, like those laws need to change so that people can be honest about what they're actually doing and not feel like they are put in a box or put in a position where they can't be honest about what they're consuming. So this is totally multifaceted in terms of what needs to change in order for this to be something that the public is educated on. And I think that this conversation and this panel is just one step towards all of that. So obviously, thank you all for your time. And I don't actually have any questions. It was more just a thank you and a comment about kind of the global sense of let's kind of keep talking about it. And all of us have conversations with XYZ number of people every single day, every part of our lives. And this is something that we can help people with within our immediate lives. So thank you.
Thanks, Kate. Do any of the panelists want to respond to that? Or
I think like one easy way, if we wanted to avoid the bud tender interaction, is that if we do put pamphlets up, something like, is this happening to you? Describe CHS, and then maybe there could be a link at like CDHP that says, here's what it is, here's the syndrome, with some referrals for patients for medications and treatment resources. And that way you eliminate the bud tender conversation or ownership of that, and it's just on the brochure.
Absolutely. I think the education for bud tenders is about showing the data, right? And showing that this is real and showing that it exists, so that like the conversation, if there is one, is like, hey, like consult this, if you have any issues, and not talking about whether they agree or don't agree with what the content of that pamphlet is. That's the education that needs to happen. as that look at your resources, believe your resources, and it's up to the patient or the client or the consumer to decide how to take that information and giving them the resources for sure.
Right, and I think we could be better at doing that on the medical side too. For our patients.
Yeah, and so I just want to say we did make a pamphlet with the Marijuana Enforcement Division about concentrate use and the potential side effects of that. So I think something similar for this could definitely be developed. That would be, and it's exactly that. It's just a pamphlet that as somebody buys a concentrate, they're supposed to be told, oh, take one of these so you can learn about it. And that way it's not the bud tender saying, you know, their opinion or anything like that.
Anyone else, or I'll go to Allison. Okay, go ahead, Allison.
Thanks. Yeah, just want to echo a lot of what Kate said. I really appreciate all of y'all being here and sharing this information. And thanks to Robin for pulling it together from so many different perspectives. What's coming up for me is how to partner to get the information out. I agree that with the stigma associated with cannabis use and the quick interactions that folks are having with providers, it is really hard for people to say what's going on for them. There's all sorts of things that we know that folks don't share with medical providers. And so thinking about how to get some education out to the providers so that they're asking the question, that it's coming up for them in conjunction with getting more information out to the public. So I would be super interested in anything that's coming out of CDPHE, or thanks Alice for sharing the resource that you have, to see if that's something that we can get out through some of the, you know, our local ERs, because we have a bunch in Boulder County that folks are using to see how on some small steps that we could do. So I guess just a comment to the folks who are on the call that I will be following up with some of y'all to see how we can get some of that information out, and would love to bring some of that, work with anyone on Collab or get that information out. And definitely on the sort of public information side, I think there's some opportunities to do that through some of the existing education that's happening to parents and young people about cannabis, making sure that this is information that's shared at the same time, to even heighten that awareness. Because I have also noticed with folks too that it's just not something that's on anyone's radar. So thinking about how we can integrate it into existing education and materials, I think is really important.
I just want to quickly echo that, Allison, because there's another side to stigma that's really important here. And that is sometimes even our providers are scared to speak up about CHS because they're scared they're going to be viewed as anti-cannabis. And that's a really spooky place to be in this particular community. You find people trying to, they're trying to be very, very careful. They don't want to be perceived as anti-cannabis. And especially, you know, there are some medical providers who use cannabis, but there has to be a safe way for them to be able to talk about it and not be accused of, you know, being prohibitionist, so to speak. So the more education they have about, hey, this is real and this is what your people need to know if they're experiencing it, that's the place we need to get to. It just is really black and white. Go ahead, Dr. Green.
You pretty much just took the words out of my mouth, Robin. I think like this needs to be as simple as a physician. Like I know I'm able to ask questions about alcohol and screen for alcohol related disorders. And I don't worry about doing that at all as far as, you know, getting stigmatized for being anti-alcohol. I think we just need to get to the point that this is the same thing. And it could be that simple. Like we don't need to make it complex, right? If you're asking a question and your patient says, yes, they use cannabis right there, and they also have this other, you know, constellation of symptoms, that should just be on the differential then. I think it needs to be that. And like you said, it's very black and white. And it doesn't mean it is CHS. It just means that needs to be considered rather than we've heard running up $100,000 in medical costs. That's just insane. And so yeah, I think that is, like I said earlier, the biggest bang for the buck, at least in my mind. And you know, where maybe it would be a good focus. I'm curious myself if there's a way to do that, because I just don't feel like how far into cannabis in Colorado we should still be at the point of worrying about asking our patients about using it. Or as a provider having to worry about that. That's awful. And so, and then I think Kate had mentioned something about like patients shouldn't have to worry about admitting to it, but that's a whole nother bag of worms, is my understanding. That's already been to the Colorado Supreme Court, and they voted, and somebody please correct me if I'm wrong, but they voted that it's an employer's right thing. So as an employer, you have the right to discriminate to some extent against your patient for using cannabis, or say, I'm sorry, you can't do this job. And I don't actually have issues with that. Like, in some ways I do, but in some ways I don't. Like for CDOT, to me, that seems clear. Okay, like we're gonna have to just make this black and white, right? Like if you're driving trucks, you probably shouldn't be using cannabis while you're doing that. So, you know, I'm not really feeling like it's worth diving in there as much, because I feel like that's happened in the past. And yes, to some extent we want to destigmatize, but at this point, this population with CHS is a smaller group that I don't think represents the whole story. Like this is a kind of separate from that in my mind, I guess is what I'm saying. And there should be a way we could do this without really even having to worry as much about that, is my hope.
Any of the panelists? Was there a question at the end of there? I don't think so, right? Any of the panelists want to respond to Stacy?
Yeah, I just had a comment saying that this stigma conversation is huge and something that we're going through a lot with. We're trying to come out with breastfeeding and pregnancy guidance, and it's specifically for physicians and how they bring up that conversation, even just to ask. So it's, and especially as you look at the different populations of who's using cannabis, who was affected by the war on drugs in the past more. Unfortunately, a lot of those users are the ones that are still using heavily, and they're the ones that are at the most fear of having a consequence of their cannabis use, so they're not going to admit it to a physician. And so it's a lot of that. We got to untangle a lot of stigma, I think, with cannabis, and a great place to start is with the physicians and just making them a little more comfortable, just simply asking it and showing the patients that it's not necessarily going to result in anything. It's just a very screening question, just like alcohol or tobacco use. So I think that's a great starting place for sure.
And I think education with physicians is the most important part, because when I was diagnosed by my doctor and I didn't believe them, it was because they were very unsure about the condition as a whole. They weren't very educated on it. And so they didn't have any resources or information to provide me with. And it was just kind of like you might have this, like it could be that, like we don't really know. And so I think giving medical professionals all the information possible about, here's the medicines that have been proven to work to stop this. Here's what people are doing to stop this. Like, here's what we can do. I think that would be very beneficial in helping patients believe their doctors.
Any other panelists?
It's hard to just say, like, so for you, maybe your doctor didn't say it, because it's really hard to say that you definitely have it, because there's no specific test that says you have it. You have CHS. It's just that you've had sequence of visits and you've had repeated visits and you're a cannabis user. So we're going to associate that. So we always say cannabis is basically a diagnosis of exclusion, where I've ruled out biliary colic or gastroparesis or other things. So it's hard for a lot of providers to say, this is what you have for sure, because there is, I can tell you have a heart attack for sure because your troponin's elevated, but I can't tell you have CHS for sure because there's no marker.
Anyone else? Or I'll go on to Ethan. Ethan?
Yeah, first of all, thank you to all the panelists for taking the time to speak with us today. Dr. Randall, you, I believe, used kind of an allergy analogy. Is there any suggestion that CHS is indeed an allergic reaction? And Dr. Holden, feel free to chime in there as
There
well.
have been a ton of theories about what is CHS, what causes it, a specific genotype for cytochrome P450. There was also at one point a theory that that was being mixed with colchicine and that might have been the cause. So I don't think there's any specific causes that we know for sure. Or maybe I'm wrong, but maybe Dr. Holman can expound on that.
No, you're right. Based on what the scientific literature shows right now, there's no specific theory as to what is causing this.
Even just a quick anecdote. When my kid was sick, there was a nurse who saw him who said, well, honey, you have to start using organic stuff. You're not using organics, and which doesn't make any sense anyway, but it was odd. I mean, everybody has a different theory. There's just nothing specific yet.
And I want to share that I did survey 330 patients who have CHS. I didn't get the survey IRB approved, so I could never post it to a medical journal, but I am working with an emergency room physician in DC right now to do that. We just got IRB approval to conduct a survey. And with the results that I found, there was no strong commonality between all the people except that we used cannabis. It was all ages. Most people were using for longer than 8 years before they developed the syndrome, but some people were using for less than a year. The amount consumed varied all across the board, and some people did grow their own cannabis without using any pesticides, and they still developed it. So it was kind of all over the place with the results that I found, but I am working with a doctor to get an IRB approved study out into the mix so we can collect some data that we can publish into medical journals.
Thank you for that.
Stacy, sorry, I talk and then I realize I'm mute.
I just, from my clinical experience working with this, just wanted to say on, the public health education side, what's really interesting is when I suggest it to my patients, like this could be the cause of your problems, and I explain, well, there's a really simple test for it. You don't have to really, actually, it might even save you money. You don't have to use cannabis for a period of time, and we'll know probably. The thing I've seen most, and this just might be an important thing to be aware of, is that people will stop using for, let's call it 2 weeks, 4 weeks, whatever, and then declare it's not that. You see, I stopped for 2 weeks and I still throw up all the time. So it's not that. And my understanding, at least in just my anecdotal experiences, usually, and I think this was already said, they need to be off longer, but I think in whatever public health material we distribute, that point needs to be made. Like, you can't stop using for 2 weeks and really be sure you don't have this, right? Like this, like you actually need to stop. That's the true test for a longer time. And then at least in my patient group, the question is, well, if you can't, well, like maybe we need to have another conversation, right? Now that's like another diagnosis and another set of issues, right? So that's, I think, a key for people to understand in the educational material. Like, quitting for a week, quitting for 3 weeks, that's not enough. That's not the test. And I've seen a number of patients and parents say, oh, he stopped using and that wasn't it. I'm like, well, you might need to stop longer to be sure. And so I think that's a point that should be highlighted for the population anyway.
For my kid, it was 6 weeks, and I've seen that a lot in the Facebook group. The other thing is that it doesn't resolve, as Alice was saying earlier. I know my kid has tried, again, because he loved cannabis and wanted to be able to use it again, and he has not been able to. This comes right back. Alice, if you have more comments, go ahead.
Yeah, so I think quitting for a minimum of 3 months is what people should do, just to make sure they get all the THC out of their system. Quitting for a week or two is definitely not enough. Like, I mentioned I had stopped using and I threw up for 16 days straight. And so THC stays in our system longer than people realize, especially if you're consuming edibles. So I definitely think a 3-month recommendation should be what is recommended moving forward in the literature. But, there isn't any core suggestion in our medical field right now of like how long people should actually quit for. People think that a week is a long time because they're so used to using cannabis that a week feels like a long time, but in reality, it is not a long enough time at all. And like Robin said, in the Facebook group, people will suffer for quite some time. And yeah, I totally agree with you, Dr. Stacy, that we need to suggest to people that they quit for longer than just a couple weeks.
When in your experience would suggest that even trace secondhand exposure might trigger it, and it's not, at least here on Boulder, it's not hard to get that trace secondhand exposure. And you also your experience with CBD, thinking people are probably going to think, oh, this will be fine. It's not THC.
That's exactly what I thought. I thought, okay, so THC is what's making me sick. Let me try CBD. And then, yeah, unfortunately, I got sick, and there's plenty of other people who have gotten sick from CBD as well. So, yeah.
And now we're getting case reports of people getting sick from other products in the cannabis plant itself. Like there are case reports in the hospice literature about people getting sick with nabilone and having the same symptoms. But I 100% agree. I think the recommended length of time should be 3 months. That's what it seems to me clinically, is that people, if they say they had it, 3 months to have a full washout.
And then Brian could have suggested this because he's closer to these researchers than I am, but we have some of the US's preeminent cannabis researchers here on the Boulder campus. And it sounds like you've already jumped through the hoops you need to jump through. It sounds like you're on the cusp of getting your study approved, but you could always approach our cannabis researchers. And I just happen to be the chair of the IRB, but I'm not influenceable. So anyways, is there any other comments, or we shall move on? And once again, as everyone has said, we really appreciate all of your time today and all of your testimony, and appreciate everything you've been doing.
Yeah, thank you all so much for coming and sharing what you know, and look forward to some follow-up. I've got some notes and that sort of thing. Thank you all very much. Really appreciate you.
Thank you
You're
all.
welcome, and I'm happy to help wherever I can. You have my email, just send me an email.
Okay, and thanks to Robin for arranging.
Thank you, Robin. And
All right.
thanks for sharing your story. I know you wanted to, but I also know that's not easy. So, and I'm really sorry to hear what it cost you, because that's just, that blows my mind. I have to be honest.
Thanks very much.
And well, as Dr. Randall says, it's a diagnosis of exclusion. So lots of things are done to prove that that might be it. So, Allison?
Sorry, totally off topic. I have to hop off at 4:30, so just wanted to say that before we transition to the next thing. So I'm really glad that this agenda was changed. I was able to be here for that panel.
Thanks for being here.
Thanks, everyone.
Okay, thanks, folks. Okay, so now we're going to go back to do the agenda as it was, which the last thing that we didn't get to on the agenda was election of new officers. Kristen, do you want to?
Certainly.
Sandra,
So this is a return to agenda item number 1 for election of chair and vice chair. So
does
some of
anyone
you
first have questions about the process, I guess?
I just wanted to share from our conversation during the planning meeting with staff that just using the beverage licensing board as just a model to think with, not that we have to emulate everything that they do, that I believe they hold an election every year. That, correct me if I'm wrong, and that typically the vice chair becomes the chair. Again, I'm not necessarily interested in that. We don't necessarily need to emulate that, but I just wanted to share that information to help guide the contours of what similar boards do as well.
Brian, while you're not interested, are you willing?
I guess I'm just concerned that we are taking up a brand new set of responsibilities, and that I have another full-time job that demands a lot of time commitments and things like that as well. So I would be happy to continue to serve in some capacity as vice chair. Happy to also someone take over that as well. But I would take myself out of the running for chair, I guess is what I'm trying to articulate.
Kristen, do you want to check and see if there are other people who would like to run? You said the usual process at the alcohol board is to elect a vice chair first, then the chair, but we don't have to follow anything they do.
No, that's incorrect. They it goes to for the chair and then the vice chair.
Oh, okay.
And I can help with that, or you can go ahead and do that if you would like.
Well, I guess still speaking as the chair, is there anyone who would like to run for the chair position? And I will tell you up front that I'm willing to continue, but I also don't want to, hog or bogart the position. And I'm pretty sure I know from Michael that he does not want to run for chair. I don't know what happened to Evan. Last I saw him, he was riding a bicycle, it looked like.
One of the things that I will let you know that the BLA has done before is they have put off until they do have a full attendance in order to make chair and vice chair. So that is an option for you as well.
Mm-hmm. Yeah, that's true.
I might ask you. I'll just maybe suggest maybe we can hold off on matter 1-4 until later in the meeting to see if we pick up another member or two.
Well, I don't think we're going to see Michael today.
Okay.
But we may see Evan again.
I agree with Kristen's not recommendation, but advice that it would be great to have all members present for this vote.
I agree as well.
Likewise.
That was a yes, Robin. There, it's unanimous.
Okay. So if what I'm hearing correct is that the information that I provided that you may continue this is what you're liking to do is to move this, to continue this to the June meeting?
Yes.
Thank you.
Now, next on the agenda, which it's buried underneath here somewhere, was public comments, and I have noticed that Mr. Guard has been intermittently virtually in the room and looked like 3 or 4 times and not in the room right now. And my guess is he would probably like to do public comment, but so I'm wondering how people would feel about also, I'm still trying to get back to the agenda.
I can read the agenda item if you'd like.
I've got it right here right now. I mean, one other item is the well, do we have someone we had on the agenda about maybe talking about the substance education awareness, but is that something where we just lost Allison? And we don't have anybody in the room to really talk about that, right?
I don't have that on this agenda.
Oh, I went to the agenda that's posted on the website. And it says tentative.
Yeah, no.
Does anyone have Mr. Guard's phone number? I mean, I think I'm connected with him on LinkedIn, but I don't know when he would get that message on LinkedIn.
I know Alana had it. Maybe if we could get in touch with Alana somehow.
It's on the policy suggestion form.
I mean, can't we just
We can
continue the
just-
meeting? And if he shows up, you could let him, or I don't really think that I mean, it's necessary.
Yeah, I
but,
think it's
I mean,
pretty straightforward.
I mean, it's up to y'all, of course, but I don't want to, we've already stalled kind of the meeting in the beginning. Let's just keep,
Okay,
I
well, let's
think we
forge
just keep
on ahead.
moving, but.
So then let's go to public comments for those that are here.
Certainly. General public comments to the board. The public comments will be limited to 3 minutes per speaker. Again, this is number 2 on our agenda today. If you wish to speak as a commenter, you can use the reactions button at the bottom of your screen, or if you are using your telephone, please use *9. This is a call for general public comments to the board. Do we have any general public comments? Chair Kunzman, I'm seeing no one raised at this time. Would you like me to call for general comment again?
I think they had an opportunity. Do we have to
Seeing-
call twice?
You do not. I just give an opportunity before you would then close the general public comment to the board section of the meeting.
I did send a message to Alana, as I think Stacy suggested. Let's go ahead and go on to the policy suggestion form.
Certainly, this would be agenda item number 3, policy suggestion forms received for the May meeting. We did receive 1 policy suggestion form from Jeff Gard of the Gard Law Firm. This was provided in your initial reading packet.
What page
This
number
is-
is that again?
The reading packet, it's page 12, or sorry, the form starts on page 9.
Yes, the form starts at page 9, and then there is an accompanying memo letter from Mr. Gard as to that. It was marked as the date received, the deadline date, and the date of meeting.
I have a question for staff, in particular, Sandra, that this would obviously need to be a recommendation that we pass on to council for them to act on. What guidance do you have about how we should approach a task if this board wanted to consider it, recommending that we replace the term marijuana with the term cannabis in the city statutes?
And before you answer, I would also clarify or ask you to clarify if the state keeps using an old term or whatever, the same term, and we switched, how does that play out?
Thank you, Vice Chair, for the question. So I guess first and foremost, these are suggestion forms, and I think the board would need to decide whether or not this is a topic that they want further discussion on, and then schedule it on your agenda for a future meeting. And then at that point, you all can decide and have consensus on whether this is something that you would want to pursue or not. If it turns out that the board does want to pursue, then there would need to be some, I guess, decision related to work plan items and where this would fit in within the work plan for not only the board, but for staff, because it would require a significant amount of work related to ordinance amendments. And, you know, if there's any thought or movement by city council to make changes related to hospitality establishments, it seems like there would be an opportunity to combine those things into one rather than taking it as a separate matter. So there's quite a few steps that need to take place, but that's kind of the pathway. With respect to your question, Chair, I'm not prepared to answer specific questions about this today, but I'm certainly happy to do so at a future meeting.
Thank you. Now you're muted.
Out of the 5 board members, I mean, just in general, is there general support for the change? That's a thumbs up from Brian.
I mean,
Tracy?
I support the idea of the change, but the thing I'm sitting here thinking is we can do all this work at the state level, it's still going to be what it is. And then we're also not aligned language wise then. And so I don't know if that's a problem. I guess I'm just wondering like how much we can get done given everything and all the challenges. Because we'd basically be the first, right, to be tackling this. Is that true? Or is this done in other states already, or does anyone know?
So I'm sorry to jump in, but if I could just suggest as a procedural matter for the board to decide whether or not you're interested in further discussion and then schedule that for a meeting on a meeting agenda. And then if there are questions that you all want us to answer that we can help with, you can provide those in advance and we can have those ready for you at that discussion.
Well, that's why I wanted to gauge the interest in the room. And we can schedule it for future discussion and future, research, I guess, too.
Did we add it to the list? Sorry, I don't mean to jump in. Did we add it to the future discussions list from I thought last month we talked about this.
Does sound familiar.
Does anybody have the list of topics to consider in the future?
Mm-hmm.
Should be somewhere.
I'm looking at the reading packet.
1 moment.
I don't know if it's must be in the last months.
It was, yeah. Any luck there, Kate?
I'm pulling it up now.
Well, she's pulling that up. Do you want to go ahead and Brian?
It is update BRC to change marijuana to cannabis. However, it was at the very, very last. So it was not it was on the very end. It was the very bottom of the list. I don't know if you were ranking them in order of most to least important.
I don't think they were ranked.
They were just in order of when we talked about them.
Okay.
Brian? Oh, you're mute.
Thank you. So I would like our board to make a recommendation on this, or encourage us to act to make a recommendation to recognize what Sandra's saying, that we should sort of lay this out so that staff can come prepared. I just want to balance the interest in sort of pursuing this important but change with there are other important matters before this board as well. So I just want to make sure that we calibrate that we are taking up our regulatory duties and trainings and things like that, and moving that forward. If there are other public health and safety concerns that are being brought to this board, that we're prioritizing those as well. But as we leave this kind of hospitality discussion, I think perhaps we might have bandwidth to take this up in future months. So I would encourage us to do so.
Okay, Robin?
Yeah, I actually agree that it's worth a conversation. I think the priority is something we can consider when we discuss it more in depth. And if the staff is coming prepared, one question I would have for this conversation is the word cannabis. I have the same concerns that Dr. Green brought up, but also cannabis, is it a parallel meaning to the word marijuana, or is it, my understanding was more of an umbrella term and might encapsulate more, but I don't know. I think that'd be worth understanding as well. So just the word itself, if we're looking at that, but I would put this a little lower on the priority list of some of the things that are on that list, but very happy to look at it. And I appreciate that the suggestion form came through, because we don't want to be insensitive to anyone.
Okay. Sandra, do you it sounds like there's a kind of a consensus among the people that are here that we'd like to, even at a lower priority, move forward on that.
Is there a question for me?
Well, do we need to vote?
You don't need to vote, but I think it'd be important for you to provide direction to staff as to when you want this scheduled.
Well, how about we, as we get towards the end of this meeting, we'll talk about future topics. And then we can prioritize future topics. How's that sound? We got a thumbs up for a few thumbs up. All right, so Sandra, if I'm not mistaken, you're next on the agenda, and I want to ask you when you want to start and then take a break, or do you want to take a break and then start?
I can do either or, whatever is the board's desire.
Well, we loosely put it that you would start, and then we'd have our break sometime around, board determined break around 5:30.
Depending on how many questions there are, I think I can work with that time frame, if that's what you're asking.
Okay. Well, do you want to go? Does that? Well, let's. Okay. Good. I think I got some thumbs up. So go ahead and start.
Okay, I'm just going to need a little bit of help, I think, from staff on pulling up the presentation.
While you're doing that, I'm going to get some more water.
Oh. Okay.
I'll be right here.
Are you able to see my screen?
Yeah, but it's not in preview mode, or it's
this. I got it in a PDF.
Okay. Well, it's fine. I don't know.
Okay.
Should be able. I am not computer savvy, so I couldn't tell you how to get it out of that mode. All right. Thank you so much.
You're welcome.
Is everybody, I guess, is Tom back? Yeah, looks like Tom's back. All right, great. So let me go ahead and get started. And as you all know, this board was created to be responsible for both advisory and licensing duties. It was anticipated that initially the board's duties be limited to an advisory role, with licensing duties to be phased in over time. The phase-in period was intended to begin 2 years from the date of the board's first meeting after formation. The timing of the phasing, however, is to be determined by the board. To recap, CLAB will determine what type of licensing matters will come before the board and which will be handled administratively by city staff. The board will also determine the timing and scope of its licensing duties during this transition phase. And as a reminder, all licensing duties will continue to be handled by the licensing manager until the board formally determines otherwise. So in preparation for the eventual transition today, I will provide some additional information to this topic in terms of the legal aspects of conducting quasi-judicial hearings related to licensing matters. Next slide, please. A quasi-judicial hearing is essentially a mini trial. It requires action by the board that adjudicates the rights of a particular person or legal entity with respect to licensing matters. Next slide, please. Before you embark on conducting quasi-judicial hearings on licensing matters, it is necessary for the board to create rules of procedure that will clarify the roles and responsibilities of all involved. The Beverage Licensing Authority has a very nice complete set of rules that would be helpful to use as a guide for CLAB. It includes rules regarding the type of evidence that can be accepted and considered, clarifies that the rule of privilege are recognized, allows the chair to exclude incompetent or unduly repetitive evidence, And the chair, in fact, plays an important role in making determinations of competency of testifying witnesses, the materiality, relevancy, or competency of their testimony and other evidentiary matters. However, the chair's actions may be overruled on all questions of evidence and procedure on motions sustained by a majority vote of the board. CAO also provides legal support in these matters, but the decision ultimately lies with the chair or the board in terms of evidentiary or procedural questions. Next slide, please. Under the constitutional principles of due process of law, the board is required to consider a set of facts presented at the hearing, which is otherwise known as evidence, and apply the criteria and standards codified in the code to the facts presented. The concept of due process is really important because it prevents arbitrary decision-making by a public body and provides for a fair and impartial process. Testimony must be taken in the form of a public hearing through the presentation of oral and documentary evidence. Specific findings of fact and conclusions of law must be written. I'll talk more about that in a minute. There's no lobbying allowed on quasi-judicial decisions and no ex parte communications, which I will go into more detail here in the next slide. So by way of example, state law and city code set forth legal requirements related to an application for a new marijuana retail license. An applicant would have to submit an application with supporting documentation to the clerk for a preliminary determination to ensure that the application is complete before it moves forward to a hearing. At the hearing, the applicant presents evidence of compliance with city and state code. The board would then consider the facts that are presented to them in the form of the materials in the packet and testimony at the hearing, and then apply the criteria set forth in the city code to determine whether a license should be issued or not. Next slide, please. So let's walk through a typical hearing in more detail. First, the clerk calls the matter on the agenda, and then the clerk swears in the witnesses. The clerk asks whether there are any ex parte communications to be disclosed. You'll need to disclose any communication you've had with the applicant or others related to this matter, and whether anything about that interaction would keep you from being fair and impartial. It is really important to avoid ex parte communications as much as possible in order to avoid the appearance of impropriety or any actual conflicts. So the Boulder Revised Code 1-3-6 reads as follows as it relates to ex parte communication. No ex parte material or representation of any kind or any other communication outside the hearing shall be considered by the agency or hearing officer conducting the hearing unless it is fully disclosed on the hearing record and an opportunity is given for comment at the hearing. Case law provides a lot of deference to the legislative body, and in this case, it was the hearing officer. It's customary to ask the applicant whether they have any objection to any of the ex parte communications that have been disclosed, and that's so that they can preserve their right on appeal. The applicant can then has the opportunity to make a presentation to the board, and the board may ask questions. You'll also have a packet of materials relevant to the completed application for consideration. Parties and interests. So under the liquor law, there are people that have rights related to hearing participation. They are typically the applicant, the adult residents or business owners in a defined neighborhood, and any school located within 500 feet of the proposed establishment. Parties in interest can present evidence and cross-examine witnesses. Then the public hearing is opened for public comment, and the board also has an opportunity to ask questions at that time. The applicant may also provide rebuttal evidence made in response to public remarks. And then lastly, the public hearing is closed and the board moves into deliberations. This is when the board will discuss whether to grant or deny the license based on the evidence provided by the applicant and whether it meets the legal requirements of the code. The law provides a lot of deference to the board's decision, and as long as there are reasonable facts in the record to support the decision, the court will side with the board and not find an abuse of discretion or overturn the decision. Next slide, please. So after deliberations, the board must take action by either approving or denying an application by making a motion. An affirmative vote of a majority of the members present is required to authorize any action by the board. The motion must state the factual findings and conclusions that support the decision. And as is in the case of liquor licensing, and I imagine that would be the same here, written findings would be provided by staff within 30 days of the board's hearing decision. And lastly, a recording of the hearing is kept by city staff, and that preserves the record for any potential appeal. Next slide, please. And that is the end of my presentation. Happy to take any questions.
Questions? Thank you, Sandra.
You bet.
I have a question, Sandra. Is there is anytime you would tune into one of the beverage licensing board, would we be able to watch one of these? Do they do it by Zoom or how does that go?
Yes, they do. Kristen could probably tell you more about it than I could.
Kristen, you're mute.
Kristen, you're mute.
Apologies, it's the theme of the last 3+ years, right? So yes, all of the meetings that they do since the video posting became available, you can see. Before that, it was just like you had where the audio is available. So you can listen to and or view them for years going back.
I just feel like that might be helpful to the whole board, that your presentation was great, Sandra, going through it, but to see it play out, I think could be very helpful.
Yeah. And in the exhibit that was provided for last month from licensing manager Changaris, I do believe we provided links to some meetings for you to listen to if you wanted to. And then of course they always happen the third Wednesday of every month, and you're more than welcome to tune into those as well.
It's on page 42 of the meeting packet from last month.
Brian, you had your hand up, but then you took it down.
No, the discussion around just finding examples addressed my question, so I just wanted to find examples to look at.
And please feel free to reach out to me directly if you have questions that you think about later on. I'm happy to try to help.
You're very kind. I didn't have your phone number until now. Oh, sorry. What we can do, I see that Jeff has entered the room and has his hand up, and I did figure that he did want to do public comment, but he may have missed the discussion about that we've already had about the suggestion, the policy suggestion form. I'll let you folks decide. I mean, I'm willing to let Jeff talk. He didn't get a chance to.
Let's just stay focused on the quasi-judicial
Well, I was
hearings
going
for
to take
now.
a break.
Okay.
I was thinking it'd be a logical place if we were going to insert additional public comment before the break.
One question for Sandra. I guess gets back to just like finding examples. So good examples are what I want to orient towards, but bad examples too, I guess, where things called undue heartache and heartburn and things like that. Like what are just like practices that lend themselves to heartburn for staff in your office when regulatory boards aren't doing their homework or aren't prepared, or what are just like bad examples for us to sort of just be aware of?
Yeah, thank you. I appreciate that question. I'm trying to think off the top of my head. For definitely coming prepared, paying attention to the testimony, asking good questions, for sure, reading through the materials and being prepared for the hearing. I think in addition to that, having kind of a robust discussion during the deliberations is critical, because you're creating a record, and it's providing background on the reasoning and how you came to the conclusion on your decision. And so it shows that you consider the evidence that's in the record, and then also whether or not, if there's a particular area where you're not sure whether or not they have met the statutory requirements, it's good to make those connections and have discussion that is connecting the facts and the evidence that's being presented to the actual requirements in the code. And I can't think of anything else. I think just kind of running an orderly hearing where sometimes it can, depending on how many folks are involved, it can get really messy, and you just want to make sure you have a lot of structure in your hearing to make sure that it works efficiently, and that you're providing folks with the opportunities to participate when they are supposed to and when the law allows for it. And I think just using the city attorney's office as a resource is helpful. Like, I think that the boards that I've supported, the ones that have worked really well, will review the material ahead of time. And if they see issues, they'll flag them and then reach out to the attorney and have a conversation about it, just in preparation for the actual hearing. And so that kind of thing, the preparation is super, super important.
Just to follow up on that point, because you raised a really good kind of procedural sort of element that, so we would receive the reading packet. If we sort of raise issues, we should communicate that with the licensing staff and cognizant attorney. And then I guess we want to make sure that we're not having public hearings that aren't public, but like, just how does that, we have been very sensitized to like only email with staff and not to each other and things like that.
Oh,
So I
yes.
just want to check in on all that too.
Thank you. I appreciate you clarifying that. What I meant was just you directly to staff, and you wouldn't copy like the whole board, definitely not. So it would just be direct communications. You don't want to have any discussions about the matters with other board members prior to the hearing.
Great, thank you.
So thanks for that.
And then those concerns that individual board members raised and communicated to staff, would those be synthesized into a report, or there be, I guess it varies on the context, it's like a very poorly formed question, but like, what often happens if a board member raises a concern about a regulatory matter to staff? Does that come up in the meeting? Does that handle via email?
It really depends on what it is, right? But like, as an example, like, let's say you said, you reached out to me, you said, well, I had this communication with this applicant about a year ago, and this is what we talked about, but I don't think it's going to keep me from being fair and impartial. What should I do about that? And I mean, I would probably say, look, I think it's important for you to disclose, and I don't think it's conflict, and that I would recommend that you raise it at the beginning of the hearing when the clerk asks about ex parte communications, and then I would ask some questions and follow up to the interaction that you described. And then the applicant would have an opportunity to object if they disagreed and thought that in some way that it created a conflict. So there would be some preparation ahead of time, but then some advice as to how to bring it up at the meeting. But it doesn't always need to be brought up at the meeting either. I mean, it's just kind of, I think sometimes people just have questions about, well, how, you know, how do I need to evaluate this in order to decide whether it complies with the requirement in the code? And so we can provide some feedback and some guidance on that. And that would just inform the way that you analyze your conclusions during the hearing. And it could come up as a question. You could share the information that you had learned during that.
Thank you.
Kate, you had a question? Oops.
I was just going to follow up and just say, like, I presume that like anything that we can do to prepare the city attorney's office to like respond if we have a question that may be something that we're confused about whether it's like, like it conflicts with, the code or whatever, so that they can look into it beforehand so that when we raise it during the hearing that, or during the discussion, they're prepared to actually respond.
Yes, that's really helpful.
Yeah. And then I was going to just ask, kind of like understanding the facilitation process. Like, obviously I'm going to watch one of these, right? But like you're talking about, the clerk, the city attorney's office, the chair, the board, the parties of interest. Like, obviously that's a lot more participants than we have currently. So can you just speak a little bit about kind of who leads that? How do you, like, how does the person ask for advice or like in the process? Just similar to this, where Tom would say, what's the proper, process for this, or ask questions while they're going on.
That's a great question. So I definitely think you should watch a BLA hearing. They have it down to a science. The clerk typically, tees things up, and Kristen, feel free to jump in, because
sure,
I actually haven't been to a BLA meeting in quite some time, but I can say that, that there are lots of different folks involved, and it is kind of a dance at the cadence, right? Like folks really shouldn't be speaking or, unless they're asked to, right? So it's usually the chair or the clerk, the licensing manager, that does that. And we would provide a lot of training with the chair and the vice chair, so that they have scripts, right? So it's not just like it's off the cuff. They actually have scripts that they can follow, so they can stick to a very a structure, and so it's not easy to kind of veer off. But in terms of like questions that if something were to come up, and you're not sure about the procedure, you can say, I have a question for the city attorney, XYZ, right? Like, it would have to be in the meeting, and then we can provide guidance that way. But it's preferred, obviously, if you see issues, flagging them ahead of time and bringing them in front of the attorney so that they can kind of think through. Sometimes it gets complicated, right?
Right.
So, go ahead.
You put that really well, Sandra, so thank you on that. Yeah. So as you'll notice occasionally with BLA hearings that we do, when they refer to the clerk, they refer to the staff member, like for this rotation, I'm the clerk, right? Or it is Caitlin in her, or John in his rotation. And so when if you haven't already looked at a beverage licensing authority hearing, we are the ones that are calling each agenda item out. We're the ones that are swearing in. We're the ones that are usually, and we're creating that flow. And part of the reason for that is because we're creating a legal record. And so we have to literally have every single agenda item carved out into its own piece and part. And so sometimes you'll hear us trip over when we're calling out an agenda item. It's because we're so used to doing that and by keeping track of, rather than sometimes the ebb and flow, because you guys aren't in a quasi judicial fashion yet. And so that's part of what we do. And we also do, like Sandra said, the swearing in and a lot of those different items. So it's really would be very beneficial for you to see the ebb and flow of a beverage licensing authority, because that format will be basically what will be very similar. And that's because it will all become part of a legal record. And the scripts, like Sandra says, the BLA has scripts. They pretty much have those memorized, and part of the reasons because they're calling out specific legal citations sometimes. And so that's why there's those scripts, and those, are followed so that the right information can get provided to the licensee applicant. And then that also needs to make sure that it's followed exactly so that it becomes part of the record. Correct me, Sandra, if I am wrong. I get a thumbs up for that. And then sometimes there'll be questions that are directed to the city attorney. There'll be stuff that is answered by staff, whether it be the licensing clerk or the licensing manager, and things like that. And it just depends in the hearing. But anything that you guys notice beforehand, that we can answer beforehand or be prepared for if we have to do a little bit more research is always appreciated.
Great. Yeah, thank you. Another question I had is about, so we've talked a little bit about like phasing it in over time and just talking about new licenses. And, what if we, like, this is just me throwing an idea out there just to see like what level of engagement we can have with this. What if we said we wanted to do one per quarter? I mean, obviously we can't choose when a licensee comes up, but could you say that, like, this would be very hard to logistically do, but like if we wanted to do one and then like we did one and then the next month there was another applicant and we had a topic that we were covering from an advisory perspective, could we push that? Or would we just say, hey, city staff, we're not going to take that one, you take that one? Like, is that even a possible like part of this to like phase it in?
That's tough, because I would worry about being, so one, you'd have to kind of write two different sets of rules, the procedure, right? And that would be kind of hard, but also I don't know if there would be any legal basis for this, but I would worry that somebody would try to make some sort of argument that, well, so-and-so got a hearing, they got the attention of the board and we didn't get that kind of attention, or, just sort of treating people differently. I guess I would be much more comfortable with you guys choosing just a type of license.
Right.
And then, being able to consider just those licenses every month or whenever they come up.
Like we could just do dispensaries if we wanted to.
Yeah.
Right. Okay. Yeah, I'm just curious because I know there was some hesitation last time, and I was just curious what options we had, right? So.
How many different types of licenses are there? Off the top, I won't hold you to it.
Sandra, do you want me to do that?
Yes, please, because I just don't know.
So we have recreational cultivation, medical cultivation, those are your grows. We have recreational dispensaries. We have medical wellness centers. We have marijuana infused products. Yeah, now my brain's going out the door. Yeah,
Is that 5?
that's 5.
But so those are just like new licenses, right? So that there's also renewals, there's
There's
modifications.
renewals, there's minor modifications, major modifications. Then we also have, for each type of licensee out there, then we also have corporate owner and officer change. Then we could have issues with like, let's say, background checks that would mean that maybe potentially come forward. I know we do that with liquor. Yeah,
And assuming for the moment that the application is complete, what's the time differential between new versus renewal?
renewals,
Some of those
well,
categories.
renewals are considerably faster if we get a legally complete renewal with all inspections done and the inspections are legally complete. Those are considerably faster. There's not really much to those. But the problem with those is that's an annual everyday thing. We have 70 current marijuana licensees, and we have a bunch of waiting in the wings, so that those, are going to grow. So that would literally be some months we send out 5 marijuana renewals, some months we send out 17 marijuana renewals. So that would be a big impact at different times.
Go back to Kate's question, what if we chose to do a certain number of categories? And by categories, I mean the 5 that you listed, and then there's new versus renewals. Currently, the staff does it all, right? And what if we chose to do new under certain categories and staff, would do renewals? Is that, Sandra, is that a way to move forward?
Well, I mean, it probably would be that you would choose new licenses, and I don't know if it's all of them or a certain category, and then staff continues to do the rest. Right?
Yeah. Ethan?
Did we not decide in the last meeting that we were going to start with new applications and staff would handle renewals?
I know that was the direction that we were going. I don't know that there was no like motion, right? Like I definitely agree that that's what I heard, is that we weren't going to even touch anything beyond new at this point.
Do we need a motion for that if we choose to do that?
It was a general consensus.
Yeah, so maybe even unanimous. So how many, I'm trying to remember what was announced in the past, either last time or 2 times ago, the approximate number of new licenses, if we looked at the past 2 or 3 years, if nothing changes, which something could, but just looking at the past 2 or 3 years, how many new licenses in the 5 different categories?
I would have to pull that up. I don't have that right at my fingertips.
Am I remembering something?
Overall, Tom, there were 83 renewals, 33 maintenance, 6 new, and 5 transfers. But that was all license types. But so that's not broken down by license specific.
Did you say 6?
6 new.
Oh, that's right.
With full year.
So
and we could say, Tom, we don't want to touch, like if hospitality goes through, we could say all new licenses that are started, go through the city until we're quote unquote ready, or when we talk about it, right? We could say we'll do all current license types for new applications, right? Is that correct? I think we talked about that last time too. We could say that. That's asking the city staff. Could we do that? Could we say all new license types that currently exist? So if the city council were to add hospitality, we wouldn't necessarily have to start that, right?
Yes, that's correct. I mean, if that's where you guys land, then that's fine. Yep.
Yeah.
Okay. So what decisions, I'm just looking at the time and thinking about a break time. What decisions do we need to make right now?
I don't think you need to make any decision right now. If you wanted to set it for, you know, like for final discussion at the next meeting or something, and then people can send out questions to staff in preparation for that, whether it's, you know, statistics related to how many licenses they approve or process or whatever the question might be. I do think that, you know, it would be good to get some direction, and then in any case, you know, there'll still be quite a bit of work in leading up to taking on that function. I think one of the biggest ones will be creating some rules of procedure, which will take a little time. And so I think there, you know, there's still some time, but it would be great to get some direction from the board in terms of what they're interested in moving forward on licensing matters. But again, it doesn't need to be a decision tonight.
Well, one more preparation question is if a new application comes in and the application is incomplete for whatever reason, you know, which could be a number of things. I'm making an assumption, but it's never good to assume anything. Does the staff catch most things and would reconcile that before it actually goes out to us?
Absolutely. The city's licensing packet is very thorough, very robust, and very detailed. And before an application gets presented to the Beverage Licensing Authority, for example, and I would assume would be similar to you, we have our duty bound to make sure that we are presenting you with a legally complete application. That's not to say that we cannot make a mistake. We try our due diligence to make sure it's not. Our application packets and our our licensing packets before they get to a board are gone through by 2 sets of eyes. So, but when we're looking at an application packet coming forward in a board for the Beverage Licensing Authority, for example, we have a deadline where a legally complete application must be submitted to us by X date in order to make it on a certain hearing, into a certain hearing packet. And I would presume, based on, you know, things that are going to kind of transition well with your licensing activities and the beverage licensing that we know that works well now, I would presume that some of that would transition forward, and that would be one of those things, that a legally complete licensing application must be submitted and gone through and done by X date in order to make it to the X date licensing packet for whatever meeting that, you know, down the road for you guys. So, but you would have a legally complete application packet at hearing to rule on.
Okay.
Yeah, thanks, Kristen. I was just gonna make a suggestion. Obviously, we don't have to make any decisions today. I don't make any decisions anyway. But my suggestion was just gonna be that I mean, think about what y'all know about cannabis and what you feel the most comfortable with, right? So I would say most of us are more comfortable with retailers than we are with cultivators or manufacturers, because most people kind of know a little bit more about that experience. I'm not saying that that's true, but I'm saying like a lot, like most public facing people that don't know the industry or work in the industry know dispensaries, because that's more public facing. They can understand kind of the ebbs and flows of like buying and selling and ID checks and all of those kinds of things. And so my suggestion would be, think about what you know, and then think about, okay, well, what kind of knowledge would you need to like compensate for in that to be able to add to this, right? So if we just suggested new dispensary or wellness center applications, then that limits, you know, it's very small. It's a very small snapshot. We may only get like 2 a year, but just think about what you know and what you like. I think that when you guys decide what you want to do, like, you know, we can phase it in, but at least like making a process and getting us to a point where we feel comfortable. I just feel like right now it tends to feel, I think, overwhelming, because you think you have to take all of these things. And if you just bite off one and just say, we'll do this one and then see how that feels and watch the videos of the BLA, like, you know, that kind of stuff. I feel like we just need to take these steps And I feel like, this feels very similar to the conversation that we had last week or last month. And so we just need to figure out what our like official next steps are so that we're moving forward.
So maybe a homework assignment is to watch a BLA hearing, and I think that's a reasonable suggestion. One of us knows a bit more about grows than others in the virtual room, but some of us have also toured that facility. So that could be an opportunity to invite members that have not been to the tour or to tour the facility for future future education or future understanding. Just hint, Ethan.
Yeah, that's an excellent suggestion, and I'll bring that up to Alana as well.
I mean, we can't make that happen. There's other grows in town too, of course, but so I still am in the interest of having a break, as some of you might also. Is there anything else to, as I said, one of our homework assignments. Yeah, go.
Can I ask a question? I mean, we're going to talk about what's going to happen at the next meeting, but I'm curious about how do we create rules of procedure, and what do we have control over and what we don't, in terms of that process. Do you think that maybe you guys or y'all could put in the rules of procedure for the BLA in the next packet so that we can see that, or is it too big and we should probably just...
I thought it was included in last month's packet, but maybe not. But that's easy to do. Just provide like an electronic link. It's.
Oh, it might have been in a link.
Yeah, I don't know.
I can double check that. We can provide a link definitely next month. If anybody is not interested in waiting though, BLA, the Beverage Licensing Authority, has a webpage just like you have your cannabis licensing and advisory page. So you're able to view their rules of procedure under their agendas and meeting items if you don't want to wait, but we can definitely make sure we include it in the next meeting packet. I'm sorry, reading packet. Well, actually, no, the next meeting packet.
Thanks.
Okay, I was just looking at the BLA site. Okay, now back to something I mentioned earlier. Jeff is in the virtual room. I was going to give him an option earlier, and I don't know what reason he was not here when he came in and out of the room several times. I did notice, so he made attempts to try to speak to us. I think he would like to. He had his hand up. I think he would like to speak to us. All right, is there anyone opposed to letting Jeff have a moment? Hearing no opposition. Can you open up to? Oh, that's what it looks like.
May I ask a clarifying, Chair Kunzman?
Sure.
Are we reopening public comment?
That's a good question. I thought of that too. Is there anyone else who wishes to have? I mean, because there is one more person in the room that wasn't here before too. Other ones had a chance earlier, but Lynn Siegel was not in the room earlier.
I think we should keep it consistent. I think if we're going to open it to one, we should open it to everyone.
Okay. Then,
all right.
Jeff, you're first.
Well, let me get my timer up, please. And I will reread the public comment section. Public comments will be limited to 3 minutes per speaker. There will be a timer showed on your screen. If you are interested in presenting public comment, please use the reaction button to raise your hand. If you're calling in, please use *9. Mr. Guard, you did appear first, so we'll be taking your name first, followed by Lynn Siegel on deck. Let me share my screen. Mr. Guard, are you unmuted?
Or can you unmute?
I am
Yeah.
now. Yes, thank you. Okay.
Your time starts now.
Thank you very much, Kristen. Sorry, I couldn't do this earlier. I hate going out of order. I know you have a lot of things to do, so appreciate that. I did have a client that came in that I needed to meet with, so I had to drop out at just the wrong time. But as you know, I submitted the suggestion to revise our ordinance to reflect cannabis as opposed to the term marijuana. The reason being, as it was discussed kind of at length last time in the CLAB meeting, which gave me the inspiration to do this, is that marijuana has always been a racially charged term that offends many people in the Hispanic community. And generally speaking, most folks that are familiar with cannabis are aware of this controversy and have sort of reformed their terminology for this. I also spoke and meet with the advisor to the governor, and they're going to work on this at the state level. As you can see, that's more of a sea change that's going to require the participation of the legislature. But that is actually on the agenda, not for this term, but next term. There was a comment made last time about, the fact that it's we're referring to marijuana based on things that are in the state laws that are referenced in the ordinance. And I clarified that in my letter that we can continue to call the Colorado Marijuana Code and things like that, and anything at the state level, refer to it by its term, but by making a point to refer to cannabis rather than marijuana, we're also showing racial and cultural sensitivity over an issue that has been very significantly racially charged for a very long time. And it's unfortunate that 12 years later, we're still living with this, but there's a lot more awareness that came in those 12 years, which is why I suggested that might be something that council would want to take a look at. So thank you. I don't need any more time.
I have one quick question, Jeff, and others may also, but are you aware of any other municipalities across the country, or let's just keep it in this country, that have already made a change? Or
many of the new states coming online are referring to it as cannabis rather than marijuana in their codes and in their regulations. Yes.
An example.
I don't have a specific in mind. I didn't do my homework on that piece of it, as you can imagine, but certainly that awareness is being shared as these laws are being passed. I'll get you. I can always supplement my motion, do a little homework on that, and see what other folks are doing.
If I can just bounce it, Michigan just did it. They were the Michigan marijuana regulatory agency, and now they're the cannabis regulatory agency. So they just did it in March of last year, and they changed everything over in their codes. And yeah.
Okay, thanks.
They still have they actually still have it in their statutes. They still have the word marijuana, and they actually spell it with an H. And they didn't change their statutes yet, but they did change all of the rulemaking from so like the equivalent of the MED.
And remember, Boulder was first before the state, so we could be first in making this change and inspire change at the state level. But I know Governor Polis has this on his mind as well.
Any other questions for Mr. Gard?
Thank you.
Well, thank you, Jeff. And Lynn or Kristen, do you need to read anything else, or can we go ahead?
No, I will reshare my screen and let her know when it is available. Lynn, are you ready to be unmuted?
How does she say that? How does she answer if she's muted?
Yeah, how could I say it? Yeah, I just wanted to
your
comment.
Time will begin now.
I just wanted to comment that I think marijuana is ridiculous. I'm so ashamed that our culture, when we've got more important things to do, starving people all over the world, a huge war in Ukraine, like all this money that needs to be spent, and instead we're wasting staff time and city time on recreational drug. Now, as far as the use medicinally, that's for the FDA to deal with. This should not be legal. It should not be an issue for the city to deal with monetarily, to take taxes in, to have anything to do with a recreational drug. It's just revolting to me that our society has come to the level that all these people in this room are spending time on a recreational drug. That is pitiful. That is so revolting. And believe me, I smoked pot plenty in my youth, and I'm 70 years old now, but their life's too short to do anything to do with marijuana governmentally, certainly governmentally. And it's just such a waste of resources. It's such a pitiful waste of resources for a bunch of airheads walking around town bombed out of their mind. This is just too bad that our culture has come to this level. And I'm sorry if that's your lifestyle, you know, or pays your bills or something, but find something productive to do, because this is not it. And this is very destructive to people's time and to people's what they do with their life. It's just such a waste. It's worse than alcohol, practically. And I don't believe in alcohol either. But, you know, why do people, what do you need to smoke pot for? What's the function? What's the usefulness other than medicinal? And that's a different thing entirely. And they're fused ultimately. So my advice is just get rid of pot completely to do with government, anything to do with government, state level, national level. It's disgusting that we have this in our society still. And I hate to say it, but get a different job. Done.
Your time is up, Lynn. Thank you for expressing your point of view. We will take it into account. All right, it is break time unless did somebody have any questions for Lynn? Okay, then in that case, break time, and let's come back at 5:43. That's 9.
Correct.
Okay.
Would the chair like me to call that as the next agenda item?
Let's see if there's any further discussion on 5 first.
Certainly.
We can talk about some things as we talk about future meeting packet and agenda updates.
Oh, in as the item under agenda number 6.
Yeah. Right. Stacy, are you with us? We have 4. We did approve the minutes, right? Okay, just double checking to make sure we did.
Yep.
I am here, Tom. I don't know if you were just
Okay.
calling, but I had a Lord of the Flies situation in my house, so I need another minute.
Okay, all right.
All right,
Wait, what did you say? A Lord of the Flies?
correct. Yes.
Wow.
Yeah.
Wait,
All right. I'll be
I
back.
gotta get the book out of my bookcase. 1 second.
Pass the
So
concha.
yeah.
What?
Chair Kunzman, I did go back through the annotated agenda and made sure we did hit everything that was on the agenda previously up until agenda item number 6.
Okay, so any further discussion on the quasi judicial hearings and moving forward? I thought Kate had some very good ideas. I just want to make sure Kate knows that. Does city staff need any further suggestions or guidance, I guess? I see a little no shake, little no with the head. Speak up, Kristen, come on.
So I have notes that you would like the BLA rules of procedures link in the next packet. You have that you would like to explore potentially just one license type only. You discussed where to listen to the Beverage Licensing Authority, and there was a discussion as to heartaches and heartburn examples.
I mean, I just found I found the website and I pulled up one of the meetings. I didn't start listening to it yet, but can we send that, some of the old meetings out long before the meeting packet was out?
I can do that, and then I would need to make that a part of the packet.
Yeah. Okay.
I was just gonna say, if you go to their website, like Kristen was talking about earlier, and you go to their agendas and materials, it pulls up their like full set of documents. And if you don't go into the year, so you pull back out of the year, so you're just in the BLA folder, it has the rules of procedures at the bottom there. So Tom, I mean, that's there. And then in terms of, it's on the main website, you can watch the last one that was on the 3rd of April. It's on the their main page. So, I mean, obviously you can send it as part of the packet, but if anybody wants to do it in the next 2 weeks, then.
Yeah, I found it pretty easily too. Sure. Okay. Any further discussion on that?
I guess I have a question about whether or not we can talk about what the parameters of like the rules and procedures that we can, like, can we have a discussion next time about I kind of want prompts. I think that like we have homework, right, to listen to a meeting, to look at the BLA rules of procedures, but are there like things that we want to like, we've had this discussion now twice and we haven't gotten to the next stage. So I was like wondering whether or not the team has any advice or thoughts on prompts for like, let's decide on a license type, let's decide on this. So new or renewals. Yes. Like let's some yes or no questions, because I for whatever reason we can't get there.
I heard there was consensus on just doing news, not renewals, and not obviously hospitality suites.
Great.
Okay.
I just feel like we're not giving them that direction. These are what we're just talking about what we may want to do. That's what I'm saying. We need like these black and white, like, yes, we're just doing new. Yes, we're just doing. So I'm just asking the group, not just you, Kristen. I'm talking to like the board. Like, what is the board? Like, what prompts do you need or to make a decision?
So can I ask a couple of clarifying questions maybe that would help us provide you with a little bit of information? Sandra, would that be appropriate? So because the difference between what is entailed in a new license versus what is entailed in a renewal, and Kate, you remember through your work with us what those differences are, and Ethan, you might be familiar with renewal, with a renewal application. Our application packets can be found on both our recreational business license and our marijuana business license webpage. That might be a little bit overwhelming for you. So one of the things that we could potentially do is provide the application checklists as part of our packet. Now that's going to give you a lot of information. What we do for the Beverage Licensing Authority, for example, is even though those application checklists are very, very detailed, we do a finding of fact document where we summarize a large portion of the application in about a 3 or 4 page document. And you can find those in the Beverage Licensing Authority hearing packets for each application. So like, for example, a Beverage Licensing Authority application, they'll receive the findings of fact, which goes over a lot of the applicant information, how long their lease possession is, any background check information that we're able to disclose. And they get that in a little bit different format because of the legal protected status of CBI and FBI background checks. We provide them with any operational characteristics and things of those nature. And we summarize all of that because an application packet can be very large. Then they also get a copy of like their alcohol beverage service policies. In this case, it might be a copy of like their neighborhood flyer and their kind of service policies, for example. And then they get a copy of their premises diagram and any zoning documents, and then any kind of questionnaires as to how they're going to operate their business. So their packet gets really kind of condensed into that. And you can see those in a Beverage Licensing Authority application packet. And so we kind of really condense that down for the authority to be able to review and look over. They also then get a copy of the petitioning materials that get circulated for a new liquor license. Now, as far as petitioning, we don't have that for a new license, for a new dispensary or a new cultivation or a new manufactured license. So we don't have those to include for use for something like that. But we could provide you with what a packet is as far as that as an example. So you could see what actually the Beverage Licensing Authority receives as far as a new. And then that might help guide you in seeing what maybe you would be receiving potentially. Would that help you to further that discussion along?
Not me specifically.
No.
I think what I was trying to get to was what questions does the board need to answer to get to what we want to do with this licensing part of the process? Like we need to decide new versus renewal versus transfers versus modifications versus this, right? Like that's kind of, I just think that I feel like we're stalled. Like we're not making decisions about where we want to go next.
So I was just thinking if you could see what the Beverage Licensing Authority looks at when they're looking at an application and then what they pull out, you know, from from the script to deliberate on, that might help you then narrow down some of those questions was what my thought process was. But obviously I'm off the mark there. I apologize.
No, you're okay. I'm you're doing great. I think it will help. I think looking, I'm just saying like we got to do the homework, but we need prompts in terms of making decisions because I feel like we're not getting there. And that's not on city staff. I'm saying that the board, we haven't been able to make a decision about what our next steps are. That's all I'm saying. I wasn't saying that you or the staff needs to tell us what to do. I'm just like, we need to decide if we're doing new, great. If we're doing dispensaries, MIPS, cultivators, like what are our next, like we need to move forward. So like,
sure.
I'm just trying to, right. That's what I'm trying to get at. Like, what are those prompts that we can?
I just figured maybe if you saw what a sample of what they looked at as far as like a new, what that might help you guide. This is what a new might look like versus, something else. But
yeah, I've already looked at one and I know the marijuana ones or the cannabis ones. So I think it would be helpful if people looked through that information along with the video of a hearing and all of that. I think it's all helpful.
Can't speak for others, but I think it'll be more enlightening after we take a look at what the BLA has to look at. And right now the consensus is to focus on new. And I didn't even recognize the acronym you just used. So I think you said MIPS. Manufactured
infused product. Yeah.
The bicycle world, that's a kind of helmet design that protects your brain from getting significantly injured.
Take your MIPS helmet to your MIPS facility.
What?
You can take your MIPS helmet to your MIPS facility.
Yeah. Robin or Ethan or Stacy or Brian, additionally, do you have anything else you want to say?
I would just echo and reinforce that I think, yeah, just doing the homework and watching some of these sessions will be really illuminating. I don't even know if it's like worth trying to structure it so we all watch a different one and can report back, we'll show and tell, but that's probably too much structure for what we need. But I think that it feels like a black box right now. And I think just like seeing the BLA do it be very clarifying.
Ethan, is it something you know about or you haven't been on the other side of the coin or whatever?
Most of my exposure is within the cultivation environment. We have other individuals within the business that handle all the application paperwork itself. So from my perspective, it's ensuring that everything lines up with the paperwork. But what goes into that, as far as the MIPS facilities, I'm not as versed in. So I think reviewing the BLA operations or proceedings will be enlightening, and we'll go from there.
Right. And as we noted a couple times earlier, the specific BLA packet and hearing that was in last month's meeting packet that we provided, those specific links, those were chosen because they do a broad range of license types in one hearing. So the BLA heard, new renewal, show cause violation, I mean, all sorts of different types of stuff. So that one really encompasses the whole width and breadth and depth of what they do.
So there are two board members who are not here, and I was thinking that I could take responsibility for telling one of the board members what the homework needs to be, and somebody else can take another. Like I can talk to Michael, and if somebody wants to let Evan know, or maybe he's already experienced it from creating the paperwork, I don't know.
I can check in with Evan.
Okay, good. Thank you. All right, are we ready to move on to agenda item 6? Got to get it back up here. It's here somewhere in one of these windows. I always say the same thing at each meeting. I need another screen. Okay. Kristen? You have the floor.
Certainly. So agenda item number 6 is matters from the Regulatory Licensing Office. Our first item on this is agenda topics for future CLAB meetings.
You found it in the previous packet because I didn't see it in this packet, right? Brian?
Oh, I was just going to ask what's next in terms of training for taking up our regulatory duties. Is there more training on the roadmap?
Sandra, you look like you want to unmute, but I'm not sure.
I can't think of anything off the top of my head at the moment that would require additional training. So yeah, I can't think of anything right now.
And Kristen, when a new member is appointed to the alcohol board, what sort of training do they get?
So we have materials that they receive as far as scripts for each type. They get binders of the rules of procedure, different relevant memos, and things like that as well. And then they will sit in on a couple of we always recommend that they sit in on a hearing beforehand And then they just kind of get walked through. We do have a couple one-on-one meetings with staff and with the BLA hearing attorney, wherein we go through a lot of different things like that. And so there are those types of meetings, and we do envision that there would be you know, those types of trainings happening with CLAB as well.
That help at all, Brian? You want more?
That's helpful. Thank you.
I'm hoping and assuming that would be a virtual binder now, not a real binder.
Yeah, and we do provide ours virtually now as well. But yeah, it used to be 3-ring binders in the old days.
The old days. Sandra, do you want to add anything to that?
No.
All right, so Kristen, was it you that somebody had pulled up the past?
Yep, that was me.
Yeah, do you want to share your screen?
Sure. Okay. So we had that great presentation today on community education on CHS. And then it just kind of goes on from there. So we've got the health conditions in general. I don't know if
You can half highlight the transition to quasi-judicial, a very light yellow.
okay, I'm seeing a hand raised, but I can't tell who.
Oh, sorry, it's Robin. I was looking at the list. Robin.
Thanks. One of the things that we've talked about a lot is the Colorado School of Public Health's Cannabis Policy Research Group. And on April 19th, they released their report, and that was a report mandated by HB 211317. It's on concentrates. And so the report is out, and I know many CLAB members wanted to know sort of what was in that report. We can certainly include it in the reading packet, but I know that there are folks from that group that would be willing to talk with us about what they learned, what the limitations to their research were that they were up against, and those sorts of things. The other thing I feel like I've heard many times is a request for conversation around concentrates, and both from former member Alana, who wants to give a presentation, and Dr. Green, who wants to talk more about health things. I have some concerns. So yeah, I think that possibly those are the things I've heard bubbling up, but certainly open to everybody's input. That's mine.
Okay. So I will make a note that one of the things that we did have on the preliminary agenda for this month was the update from the Substance Education Awareness Fund. That had to be pushed back, and they are hope to come back to us in June because of the timing of this.
Okay.
Is that okay?
Let's see. Well, Robin, I just tried to Google what you just said, and I could not find. Is that publicly available?
Yeah, it is. It's on the Colorado School of Public Health website. I think the thing to look for is the Cannabis Research and Policy Project. But again, Tom, I mean, if I can send you the link.
That's all right. And do you think, would you have any idea if someone is available to present? And do you think that would be something that would be presented at the same time as giving the floor to Alana?
Great question. I don't know.
How extensive is it?
Report, I mean, my read on the report was there's not a lot of great data. There are some, there is, you know, they sort of graded the evidence for different impacts. And I think it'd be worth a 30-minute presentation from somebody from that group to walk us through it and to allow the board members to ask questions. That would be my suggestion. Now, is that given at the same time as Alana provides her info? I don't know. That could create some tension. I'm not sure. And maybe, Stacy, you could comment maybe, because what you were asking about with wanting to have a conversation about concentrates last time, as I recall, was maybe a little different from learning about the different types. So I think we're asking a lot of different questions as a group. That was my read.
Stacey, you want to give any guidelines?
I think if it's a bigger topic, then it's probably easier not to put them into the same session or meeting. If it's something we feel we could get through, you know, that's just more pragmatic, maybe. But I think if we try and do Alana plus like whole thing on concentrates, that, I mean, that would sound like a lot, or a presentation from the state, that sounds like a lot to mix to me, but I could be totally wrong, because I certainly would not be the person to ask about managing agendas and stuff like that. That's not my area.
Ethan, would you be interested, would you want to go out on a limb and take a guess as to whether Alana would like to present by herself or with others, and not necessarily this state, whatever, the comprehensive review, but we had talked about maybe having more than one speaker.
Yeah, I talked to Alana briefly about it. I know that she has some other individuals in mind that she knows would be certainly qualified to speak on concentrates. I think I saw it in the suggestions page that's being shared right now. You know, Cinnamon Bidwell, someone that has been mentioned in the past as far as speaking on that. But you know, we can certainly follow up with her. Do we know what the status is of the motion to have her be able to present in front of CLAB?
So that is on our this section of the agenda as well.
Yes, go ahead.
It was approved.
Okay.
Yeah, okay. So Alana, you know, if everybody remembers, there was a question whether Alana could speak to us. The city council has approved that she can address us.
I don't know if she has received that information yet, but I will follow up with her, and we can start planning something.
Okay. Do you think it would be rushing things to ask her to do something next month, or should we go ahead and ask the school of public health people if they're available?
Since 1317 was just released, it might be worth moving forward in that direction, just to allow Alana a little bit of time to prepare and get in touch with anybody else that she would want to be involved with that panel.
Okay, give her a little more time.
Yeah.
And then either Robin I don't know, Stacy, do you have any interactions with anybody on this panel, or Brian?
Who was it that suggested John CMAT, who's listed at the bottom under speakers, to come and talk about the report? He's the first person listed there. I don't know John. Somebody else must have suggested him.
I'm thinking he came and presented once before to us, long before, like, I don't know, in the past 2 to 3 years. But I did not present his name. Is he
Happy to
instrumental?
reach out and see if they're doing, I know they're doing comms around this and probably would really appreciate the opportunity to come and talk, send somebody to come and do something similar to what we just did, would, just give us an overview, walk us through the report. I didn't find it to be an earth-shattering report. I found it very interesting, and you all probably would too. You can obviously read it on your own, but if you wanted somebody from the group to come, I don't know, Brian, if you know anybody in the group or could maybe connect more easily since you're at CU, I don't know, but.
Yeah, happy to coordinate with staff if and just draw my networks and things like that. But there's no one off the top of my head.
We did have, it looks like we had him speak once before. Or he chose to spoke at public comment or something like that. I don't know if, is that something easily researchable?
I mean, his contact email is on the front page of the report.
That's easy.
Or at least the contact name with at least the email address. Like, there's a generic email address that could be sent to cannabis.research@CUAN or CUAnschutz.edu.
Okay. Brian, do you want to reach out, or do you want me to, or do you want staff to? Or staff, do you want to?
Well, that's staff.
You okay with that, Kristen?
Um,
I'm fine doing it also.
yeah, I just don't remember staff reaching out directly for speakers before.
And I'll take the lead on that.
Yeah, it's not that we don't, I just don't remember staff taking that on as a role.
I didn't open the report. It's right there. Kate, you said it's easily findable.
It's not, now that I look at it, it's not his specifically, it's just the cannabis research at CUAnschutz.edu. It's the basic, like it's the general email address.
Okay, well, I'll try to find
if you wanted to contact somebody. But you could still, I mean, it says contact Jonathan Samet. I don't know how to say his last name, but Samet.
Okay, well, maybe I'll send it to both if I can find his email. Okay, so, and then I'll let Kristen know as soon as I get a response.
Sure.
So we'll try for Smith. What's her last name again? Bro?
Yeah, so they have been moved to the June to make room for a little bit more time for the panel discussion that we had today. So that's why they were moved to June.
Okay. Well, I just found his email. That wasn't too hard. Okay. Now I got way too many windows open again. What else is on the list for item number 6?
Oh, so for item here, I'll stop sharing. So item number 6.
City council motion. We talked future meeting packets.
Sure.
We're gonna
Certainly.
What are you gonna make about that?
Sure. So in order to align with the beverage, specifically the Beverage Licensing Authority and other boards and commissions, we are transitioning to 1 packet only per month. You will be receiving that 1 week, the week prior to your meeting. So you'll be receiving those on the Thursday, 1 week prior to your meetings. And then as far as the agenda, that's going to look a little bit different as well. Currently, your agenda has your mission statement on it. We are going to be taking the mission statement and putting it on your packet cover sheet. There will be the published agenda, which will have some information, our generalized information on it. And then there will be the a little bit different looking agenda that you will receive in your packet. And that can fluctuate based on what we have happened from the difference between the required publication deadline date we have, and then the by the time that the agenda is in final version for what it reaches to you. And so that's going to change a little bit about how that's looks for you, in addition to kind of what we talked a little bit about in getting you prepared for whenever quasi-judicial roles come about. We will start having the licensing clerk call the agenda items at each hearing, or each meeting. When you listen to the Beverage Licensing Authority hearings, you'll get a feel for what that's going to sound like, and that's going to start in June. And so all of these changes will start with your June cycle.
Okay.
Does
Any
anybody have any questions on that?
Robin?
Just going to say that consolidation sounds brilliant. I love it. Thank you for all the work you guys do on these packets. It's a lot.
Well, thank you. Yeah, it's not going to really change, the volume. You'll still be getting the same things that you get all the time. It'll just be laid out a little bit differently. And you'll just be getting one packet, just like the other boards and commissions do.
So we would all echo Robin's comment.
I'm sorry?
We would all echo Robin's comment. Thank you.
Yeah, and you'll get used to us calling it. Just think of us as, auctioneers behind the scenes. No, just kidding.
So item number 7.
Certainly. So as you were told previously, this month was supposed to be where we transitioned to Zoom webinar. Unfortunately, that didn't happen, and that will begin with next month. That's going to be when we go into when the meeting dumps in, everything will become immediately on board. Everything is live. Everything is going to be recorded. There will be no lag time. So we'll just remind you that literally the minute you enter into the room, everything is on recording. Everything needs to be, all business. Save your discussion for, some other time. Does anybody have any questions about that?
Okay.
Great. All right. And then moving along is your final agenda item, matters from the chair and members of the board.
Brian, did you want to take this up, or do you want me to start it, or no?
Why don't you frame it up and then I can take your hand off.
All right, so I'll give the history as I know it. As Ethan intimately knows, and I know that we both interviewed for positions, or even for a new position. I interviewed for continuing on the board, and at my interview, some discussion came up with the city council person that was there, which was Rachel Friend. She asked if I had any questions, and I said, we're soon gonna have some hospitality recommendations, or we're gonna have a list of recommendations that are gonna come to the city council. Do you want to know anything about those before they actually come to you? And she thought that was a good idea, and then she consulted with Aaron Brockett, the mayor, and they, I think, mulled it over for a while, and then like just before, I don't remember exactly when it was, Brian, but sometime in the last few weeks, just as I was going out of town, Rachel said, can we do that meeting that you guys talked about? And I was gone. So Brian spoke with, who was all there? Kristen or Sandra? Who else was there from the city?
Yes. So on Monday, April 17th, I met with member friend Mayor Brockett. I think Kristen C was there as well. And that was an opportunity for those two members of council to just share some feedback about the recommendations that we referred to them. And I would say there's two main points from that. The first being that our set of recommendations arrived in a format or style that they were not used to like reading in their reading packets or digesting. And so that was one bit of feedback that they got us, was that they wanted to see the kind of the recommendations that we provided to them be reported out in the same way as other boards report things out to this. So a lukewarm response I would characterize to like all the effort we put into sort of formatting and writing that cover letter and things like that. And then the second bit of feedback that they shared was that the city council has a full agenda for the remainder of the year. And there's not a tremendous amount of appetite for the current council to take up this matter. So again, it would likely fall back to going on their January 2024 agenda setting kind of meeting would be the time to sort of revisit this for the city council to take this up.
So questions for either myself or Brian?
Can I add some additional information?
Sure.
Yes, please.
So I wasn't at the meeting, but I just want you all to know that these are two council members, right, out of several. And so any decisions made would be made by the entire council in terms of what moves forward or not. And I will say that there was a request, I think, from Councilman Fulkerts during our scheduling exercise this morning that to put something on a future council meeting agenda for discussion by council, and they wanted to know, basically to have a discussion about, does council want this to move forward? When would it move forward? Have an opportunity for them to ask questions about it. And so that will probably be scheduled at some point. I don't know when right now, but it will be something that staff will take under consideration and then set it for a future meeting in the near future, probably like this summer. And then the other thing that I wanted to add is just that I did reach out to those two council members to get some more feedback in terms of, the format and what would be helpful. And the feedback that I got was basically that it would be helpful to have a paragraph in the executive summary that listed the successful motions in their final form. So there's like that motion that was superseded by another motion, you would only put the final motion that would be considered. So I think it's probably just, they probably found it a little bit overwhelming in their use of more concise information being presented to them. And I think this board had an interest in showing all the different perspectives on the board. And I think that's all well and good, but I think in the interest of making sure that they received the proper information, I think that those two at least would have appreciated a more concise executive summary that actually listed all of those motions clearly.
And yeah, I guess to round out something that Sandra just brought up, that one of the examples they mentioned is that they didn't understand like why motions that didn't pass were included and things like that. So we had a logic, and I'd stand by and that logic, but that for our ultimate audience, they just want to see the motions that passed.
Okay. So Sandra, you said this would be sometime potentially this summer? Suggestion from
Well,
Laura?
What I said was that a council member requested that an item be placed in a future council meeting where there would be discussion by council about it. So they would talk about the information that they received from CLAB and presumably give staff some direction on any work plan items.
Okay, so that doesn't mean that's not asking us anything further.
You cut out, say that again?
That's not asking us anything further at this time.
Not at this time, no.
Okay. But it is potential that they would want to get like it's kind of like at the last minute they wanted to have us review what like when Brian went and spoke with the 2 city council people. That could happen, right?
So I'm not sure I understand your question, but
So it's like here's how it played out. I think I was leaving for I do consulting work, and I was heading out for New York City, and I was leaving on Monday, and I get a message on Thursday or Friday that, oh, can you come and talk to the city, or can you have a meeting with these 2 city council people? And I couldn't. And so Brian was gracious enough to represent, or not represent us, to attend as a member of the club.
yes. And what is your question?
I'm just worried that they're gonna do the same thing again, that they're gonna say, oh, we need somebody from CLAB to come and talk about these, and we'll find out about it at the last minute.
Okay. Well, first of all, I guess I just want to explain that any one of the board members can reach out to a council member and have a conversation about this, right? There's nothing that prevents anybody from doing that. And secondly, I would say that if there is something that does get scheduled in the near future, staff would do their best to give this board a heads up about that. And of course, we would ask as to whether or not they wanted participation from this particular board, and in what way, what would help them, what kind of information, additional information would help them during that discussion. But it's not going to be a situation where the board will be invited to come speak.
Yeah, well, I wasn't implying that. But okay, it is what it is.
So, we'll do our best to give you as much heads up, but I mean, just because they reached out to 1 or 2 of you to get some more information, that could happen to anybody. And I think they're just trying to learn more about it. I would not view that as a negative.
Okay. Does anybody have any questions about that? Is it, I'm trying to think of how to phrase this, but I know there's word out there about our recommendations out in the public. There's discussions going on, because I heard from some industry people about some of our recommendations and questioning as to why we decided the way we decided what we decided. So word is out.
I saw a very good article by Shay Castle, Boulder Beat. She covered it. She covered it well. She covered all aspects. Really good article. I can give it to Kristen to put in the reading packet. If you haven't seen it already, it's really well done.
I've not seen that one.
I can do that. Just as a heads up, the deadline for packet is the 15th.
But just like the other thing, it should be easy to find that article on your own.
Yeah.
So, Okay. Any other questions? Otherwise, we can finish early. Motion to adjourn unless somebody else has other items of information. You guys want to stay here till 7?
Absolutely. Brian motions to adjourn.
Any second on that?
I'll second it.
Stacy seconds, and any opposition or abstention? All right, well, thank you all.
Thanks, everyone. Thank you, staff.
Yeah, thank you, staff.
Have a good night.
Thank you.
Thanks, everybody. Have a good month.
Hey.